So, don't know if this is on. Hi everyone, I'd just like to welcome everyone to this first children's overview and scrutiny of a new administration and cycle. So firstly, to do apologies of absence, which is that the Democratic Services Officers received apologies from Councillor Halcroft-Scott, Councillor Perfect and Councillor Jackson, and then Clive Mayling, who is the Roman Catholic Church representative. And then to move on from that, if we can sign the record of the meeting held on the 2nd of March, which I believe only Councillor Turpin would have been present for. So... are we happy to sign that as agreed? Yeah, fine, thank you. Item 3 is just that urgent matters and there aren't any. And then if any councillor has any DPIs, OSIs or whipping that they need to declare.
I'm obviously not a councillor, however we do have an interest as a forum in the family and children's hubs item, so we'll step out and sit over there.
Okay. That's cool. So if I can then come to the first proper agenda thing, which is the public health items. Yeah. So before we move to that agenda, can I propose a revision to the order that the items are taken in, which keeps with the agreement for themed items to be taken first, and I propose that we take item 8, which is public health, and then move on to items 5 through to 7.
Yeah, I think that's
sensible.
sensible.
Original agreement.
I think that's sensible, Chair, to do the theme first. I move.
Let me see if I can move this.
When you speak,
That's, yeah.
I'm having trouble hearing clearly what you're saying.
Okay, that's...
So.
Can we just remind everybody to please bring their mics close to them when they want to speak? Thank you.
So, is my mic clear? It's very loud now. So we're happy with the proposed change of agenda. Agreed? So then, yeah, item 8, if anyone has any questions or comments. Okay. So we have reports on family hubs and Start for Life programme, infant feeding strategy, child obesity, Ailish Gelden Hayes from Public Health, Principal and Head of Public Health Programmes, and Scott Elliott, Health Principal and Head of Health and Wellbeing Services, are in attendance and will provide a presentation prior to opening up for debate.
Sorry, Chair. I just had a quick question on item 8. I don't know if we've moved off it. No, okay. Just on the family hubs, I was just wondering what measurable impacts we were expecting for the spend.
Okay, I think before it, we've got a report from
right.
the officers on it. So we'll
Sorry, I thought you asked for questions.
Sorry, that was...
No, we're going to receive a presentation first from Ailish, and then we'll be able to move on to the debate, and questions can be taken after the presentation.
That was my mistake, sorry, Councillor Williams. But...
Thank you. So, Chloe, I think you're... Thank you very much. So Scott and I are going to do a brief presentation on the 3 papers that have been presented tonight. We have also got an interactive quiz as part of the presentation as well. And on your desks, you'll have QR codes. If you've got a smartphone, you can scan the QR code and it'll take you directly to the quiz. If not, you can, into your laptop, type the website, which is menti.com, and put in the code, and that'll take you directly to the quiz. And it'll just inform part of the presentation and our understanding around health inequalities for children and young people in Medway. So if I start by just talking a little bit about the background and the Family Hubs program itself. So over a number of years, there's been a variety of publications around the importance of the first 1,001 days. So from conception through to the age of 2, 2.5. And it's this number of reviews that have now informed the decision to invest into the Family Hubs and Start for Life programme. The latest review was the Best Start for Life, a vision for the 1001 critical days. And this Best Start for Life review set out 6 clear action areas. The first 3 were about ensuring that families have access to the services they need, and it was about having seamless support for families and information for them as and when they need it. And the second 3 action areas were about working together as an integrated system around families and ensuring that our workforce was empowered and trained to be able to meet the needs, and that we worked as a leadership system to be able to support our families. In terms of the Family Hubs and Start for Life programme itself, there's 3 clear objectives of the programme. The first is obviously to support parents and carers to nurture their babies and children so that we can improve health and education outcomes for all. The second is about building the evidence base as to what works when we're trying to support our families. And the third is about a contribution and reduction to health inequalities in both health and education outcomes for our families across England. So when we're thinking about health inequalities and thinking about the Start for Life programme, I think it's helpful to also be cited on the Core 20+5, which is a health inequalities framework within the NHS. There's 2 programmes, one is for adults and one is for children, and the one that I'm presenting at the moment is obviously the one for children. And the Core 20+5 is broken down as thinking about the Core 20 being the 20 most deprived areas, so ensuring our services are equitable and accessible to those residents in the 20 most deprived areas. The plus element is looking at, as a system, who are the other targeted cohorts that we think may need additional support in order to have equitable outcomes. And when it comes to children and young people, that might be care experienced children, it might be families with special educational needs and disabilities, it might be families from Black and minority ethnic groups, and it's for us as a system to understand and decide who those plus cohorts should include. And the 5 element is talking about the 5 clinical areas of inequalities that have been identified in health. And as you can see from the slide, it's asthma, diabetes, epilepsy, oral health, and mental health. And hopefully as we go through this presentation, you'll understand how the Family Hubs and Start for Life programme aligns with these principles within the NHS as well in order to address inequalities. So, if the magic of the internet works, we now have the opportunity to do this quiz. So please can you scan the QR code or sign up at menti.com and enter the code that you can see on the screen or that you will have on the table in front of you, hopefully. I'll just give a few minutes for members to do that and get ready. If you can click on that like button once you've managed to do it, it gives me an idea of how many people have signed up. Thank you very much. You can see us joining now. You can see on the screen there, we've got 16. I'll just give it another minute. Okay. So the first question is a warm-up question, and it's just to help us as a public health team understand from your members' perspective what you think about when you think about health inequalities in children. So it's a free text for you to be able to put in a word that you think about when you think about health inequalities in children in Medway. Okay, and as you can see, some of the things starting to come up, obviously poverty coming through very strongly in terms of health inequalities, but also some of the items we'll be talking about tonight in terms of obesity, malnutrition, developmental delay, access to medical care and nutrition, parents. So thank you very much. That hopefully, as I say, some of this you'll hear, the opportunities to help support some of our communities around these areas, but it's also helpful for us to think about future meetings and how we can bring items that help to address your questions around this. So first question for you. So we're making you work tonight, and thank you to the 16 players who have signed up already. And the first question is coming up now. So the percentage of mothers who smoke at the time of delivery in England is 9.2%. So that's the average across England is 9.2%. What do you think the percentage is in Medway? Please pick an answer. You'll have 13 seconds. Oh, everyone's voted. I can go. Oh, sorry. So, 5 people got it right. The percentage in Medway is 10.8%. So, whilst the average in Medway is higher than the England average, it's really important to see the trajectory over the last few years. So in around 2013, this percentage was sitting at about 24%, so almost a quarter of our mothers in Medway were still smoking at the time of delivery. And just 3 years ago, it was sitting at 15.9%. So there's been a significant amount of work done by the system to try and address these smoking at the time of delivery rates. And hopefully it's fairly obvious in terms of the impact that smoking at time of delivery can have on our children. Carbon monoxide from tobacco actually reduces the amount of oxygen getting to the baby through the placenta. And this can lead to premature labor, increased incidences of stillbirth and miscarriages, but it can also have long-term effects on children in terms of developmental delay. It can affect hearing and eyesight, and it can also affect long-term conditions for children such as asthma. So next question. The percentage of babies with low birth weight in Medway, is it higher, lower, or similar to the England average? Okay, what did we think? Okay, so the vast majority of people are thinking that it's higher, but actually in Medway we've got a similar rate as the national average. But it's important because lower birth weight can lead to increased risks of mortality, developmental delays, and poorer health in later life. And low birth weight can be due to a range of different reasons, but some of which are preventable, such as smoking during pregnancy, healthy maternal weight, and lifestyle choices such as alcohol and drug use as well. Right, next question. Right, the percentage of babies whose first feed is breast milk nationally is 75%. Do we think it's higher, lower, or similar rate in Medway? Yeah, unfortunately in Medway the rate is lower. It's actually less than 60% of our babies have their first feed as breast milk. And we know that breast milk is really important, not just because of the necessary nutrients that can have protective factors for baby, but also in encouraging attachment and emotional bond between mother and baby as well. Okay, health visitors carry out a mandated check at 2 to 2.5 years. The national average of coverage is 74.1%. What percentage of Medway children have the check? Okay, scores on the door. So actually in Medway, a significant proportion of our families have the 2 and 2.5 year check. Now this is a more challenging check nationally for health visitors to complete, because at this stage a lot of families have gone back to work. Some have gone on to have second or third children and are less concerned, and so are less likely to take the check up. But it's a really crucial one because it's the last mandated check before children will start school at the age of 4. And it's the opportunity for health visitors to carry out the ages and stages questionnaire, which is where they can identify if there's any sort of developmental delay or problems that might affect school readiness. And so whilst it's great that we're having a higher percentage of families taking up this check in Medway, it's important that we get as many as possible to complete it. Right, two more questions. Okay, this one relates to asthma. And there are 131.5 hospital admissions for asthma per 100,000 in the under 19 population. Nationally, what do we think the rate is in Medway? Yeah, so the rate in Medway is higher than the national average at 178.9. The interesting facts around asthma is that the prevalence of asthma across the population is relatively evenly distributed. However, the percentage of families who are likely to attend for an emergency hospital admission is higher in deprived wards. And so there's something we need to do to be able to support those families around the management of the asthma and their asthma care for their children before it leads to an emergency admission. And finally, in terms of childhood obesity, we have 11.1% of children are measured as obese in year R. What percentage does this increase to in year 6? Okay, no one got this one right. So in Medway, it's 26.2. So as we can see, the significant difference between year R and year 6, we are seeing an increase in those obesity rates. And so I'm not going to go into too much detail because obviously Scott's presentation will give us a lot more information on what we're trying to do to try and address that. But I will say that we have seen the rates decrease since we had a significant peak during the COVID period, and the data will be evident in Scott's presentation later. So, Earthman, whoever you are, congratulations. You win the honor of knowing the most about health inequalities in Medway. So thank you for that. And thank you for participating. Hopefully it's given you some insight into some of the inequalities and the things that our programs that we're doing are going to try and address as we move forward. So let me talk a little bit more now about the actual Start for Life program itself. So the Start for Life and Family Hub program, they published a really significant program guide last summer. It's nearly 300 pages long and is pretty detailed in terms of the expectations that they set out through that program. What they are clear on is that they understand that some areas, so only 75 local authorities across the country were eligible for the funding, and they recognize that there'll be variety in those services across the country. And so they have identified minimum expectations that they expect all funded areas to have achieved by the end of 2025, but also some go further options that can be signed up to as part of that program as well. And here's some of the cross-cutting themes that can be identified within that. So as I talked about, it's about enhancing existing provision, but also about maximizing access. And this isn't necessarily about maximizing the number of hubs or facilities that are available, but about ensuring that we have both physical, outreach, and online resources and support available for families. It's really important that we do the comms and engagement around this so that families understand what the Start for Life offer is and how they can access that. But crucially, the program guide also identifies that what they want to see at the end of it is that organizations are working in a more integrated way to be able to support the needs of families. And that includes how we manage information around families, how we share information, and how we do joint assessments. The risk around this program, I guess, is that currently the funding is only up until the end of 2025. And so what we need to be very careful about is how we invest this funding in a sustainable way to ensure that if the funding doesn't continue beyond the end of 2025, that we have a legacy and some sort of support available for our families beyond that. And therefore, within the program and within what we're doing within Medway, is a real focus around peer support and workforce development. So how do we ensure that families can support each other, but also that staff are skilled to be able to support them over the longer term beyond the life of the funding. And of course, crucially, that the program itself is co-designed with parents and carers. And you've heard Lisa declare her interest, because Medway Parents Care Forum has been a crucial partner for us to this point in terms of designing what the service should look like and what needs need to be met. So there's 6 key areas of funding within the program, and it's broken down by these percentages within this table here. I'm going to go into more detail in terms of what these different strands are, but this just gives you an indication of how we need to ensure the funding is spent. And each of these have got very clear expectations within the guidelines, and so the funding has to be spent in a very specific way. The way we've approached this Medway is that it's a combined program led by both public health and children's services. So we're working very closely with Family Solutions and the Early Help team to ensure that it both has that universal element, but also supports the early help agenda. And we've carried out significant scoping and engagement to date with not just partners across Medway Council, but with maternity services, health visitors and school nurses, voluntary sector organisations, and as I said, parents and carers themselves. We've also done the work to try and identify which of the strategies that are already existing this work links into, to ensure that we're building on the actions and the priorities within those existing strategies, rather than starting something in a silo separate from that. So that includes our parenting strategy, our early help partnership strategy, infant feeding, child-friendly Medway, and the Supporting Families program. We've established a multi-agency working group with subgroups that are aligned to the 6 strands within the program itself, and this reports in through the Early Help Partnership Board, which is chaired by Leanne as the Director of People. So now looking at those individual strands. So the first strand is the Family Hub strand itself. And this is about making sure that, as I said earlier, that it's not just about having a physical presence, but about ensuring that families understand that the offer, that the workforce is well sighted in how to support families, particularly that from conception through to the age of 2, but actually that the Family Hub program should support right through to the age of 19 or up to 25 if there's special educational needs and disabilities. It's about increasing the range and the number of services available through that hub support and that Start for Life offer. There is a small element of capital funding. It's not the sort of funding that would build new hubs. It's about ensuring that the infrastructure within those hubs is able to meet needs, but also that the hubs themselves are accessible for our families. And the way that we're using this funding in Medway is to fund the transformation team to take this piece of work forward, but also to fund the workforce development, so the training and the upskilling of the staff within the hubs and within those teams that operate within the hubs, but also looking at how we can have adaptations within those hubs to meet the needs of our families with SEND and accessibility. So, for example, can we have sensory rooms within hubs that families can use, and those sorts of programs. The expectation within the Family Hub guide is that there are around 24 other services which won't be funded through this program, but there's an expectation that we will ensure are included as part of that offer. And it's a pretty broad and wide range. It includes maternity health visiting, but also domestic abuse support, housing support, public health services, mental health services. And it's about how we ensure that this is a cohesive and coherent program that is able to signpost or have face-to-face interaction with this huge range of services. The second strand is perinatal mental health and parent-infant relationships, and this is really about promoting those positive early relationships and good mental well-being for the babies and their families. The focus is particularly on the mild to moderate, because actually there's an NHS investment program into the more acute needs for perinatal mental health. And the offer is for there to be a range of approaches that support not just the mothers themselves, but co-carers and dads and families around the baby as well. In Medway, we're looking at mindful parenting programs. We're very lucky in Medway that we have a voluntary sector organisation that have recently won some lottery funding to deliver mild to moderate mental health services, and so we're looking to see how we can expand on that to have peer support and also workforce development training opportunities, which will be VCS-led. And we're also looking in to see whether there's online counselling support that can be accessed. Members may be aware of tools such as Couth, which we have for children and young people to access online counselling support. There may be families and mothers out there that actually find it too daunting to even leave the house and attend a group, and maybe an online counselling support opportunity might be the first step for them to be able to move towards that. The third strand is around parenting support itself, and this parenting support is really focused on new parents, so first-time and expectant parents, and how they can make that transition to parenthood. It includes both universal and targeted provision, and there's an expectation that there'll be face-to-face, virtual, and outreach support around this. What we're looking at in Medway is some targeted support, particularly for our families who have children with special educational needs and disabilities. We're looking to work with voluntary sector organisation to develop an NCT-style antenatal offer that can be delivered both during pregnancy and after birth, about getting parents to be parent-ready and understand that universal needs and how they can access support. And we're also looking to fund some bespoke parenting programs such as Triple P and Incredible Year. One of the strands is called home learning environment, which in itself, it doesn't necessarily read as what it says on the tin, but what this is specifically about is those families, those children who through the COVID pandemic may have missed opportunities to access childcare support, attend nursery, and have that kind of social and development opportunity that would have been normally in place. So essentially it's looking to ensure that our 3-4-year-olds are school ready by the time they start at reception. And it's specifically thinking about speech and language, so developmental delay around communication issues. And in Medway, we're looking to develop a tiered approach to that in terms of having support for parents who may have concerns and being able to give them some initial tools that they may be able to do with the children themselves, simple things to be able to encourage speech and language development. And then using the health visitor's 2 to 2.5 year check to identify families where there may be developmental delays and be able to signpost them into an evidence-based speech and language program, but as an early intervention before they start school. And then there's an expectation that we have a clearly publicised Start for Life offer, and that every new family has got a hard copy of a Start for Life offer and understand what is available for them in the area. And there's also a requirement for us to establish parent-carer panels who will help inform the work and make sure that it's being delivered in a targeted way and meeting the needs of the communities. And what we're doing in Medway is we're aligning to the child-friendly Medway branding and ensuring that everything that we do falls under that and that there's a clear scope and design around that. And we're commissioning an independent parent carer panel to be able to have that one step away from us so that it's truly an independent voice and helping us understand how we can meet needs. And as part of that service specification, we are asking them to think about diversity and how they can engage with hard-to-reach groups that may not normally come forward to be able to inform the programme. And the final slide is around, or the final slide for me, is around the strand in the programme, which is about infant feeding support. And this is about really trying to increase the number of babies whose first feed is breast milk. The expectation is that there will be one-to-one practical help available on hospital wards, that there'll be antenatal class support, both for fathers and mothers and co-carers, and that we'll have targeted and focused support available for those who are less likely to breastfeed. And in Medway, what we've done, and Scott will talk about this more in his presentation shortly, is we've done some insights and some research to understand the cohort, and we are looking to commission a service within the ward using non-clinical staff to be able to do those first breastfeeding support and initiation. So I'm going to pass over to Scott now.
Thank you. And we thought we'd take the presentations all in one go, because there is obviously a clear overlap between what a lot of Ailish has mentioned in terms of the two issues we're going to deep dive into. So infant feeding and child obesity. Luckily for us, the Family Hub Start for Life programme is about, has insisted we include infant feeding, but we'd want to do that anyway. So if you're looking at the performance tracker for the last couple of years, infant feeding, breastfeeding rates has been one of our most stubborn indicators to really improve on. So we're pleased that there is a mandate, we've got to spend a chunk of that money. But before that work, there has been a previous infant feeding strategy, and there's one before the 2018 strategy. So we are currently refreshing that, and I want to give you a brief update in terms of what is going wrong. Do you want to? Yeah. So this is our current breastfeeding rate. So this isn't our trajectory, don't worry. This is effectively looking at the journey of a infant in Medway. So the key number is that third dot in, so just under 70%. So about 66% of infants' first milk will be breast milk. And then the second dot, which we know of, which is accurate, is that 6 to 8 week measurement, which health visitors do. We know that's around about 40%. But the reason for the line is to show that it is possible to get to 99% prevalence. We know that because other countries around the world do that. I'm not too optimistic that any country in the West will ever get to 99%. But it just kind of shows that potentially, pre-pregnancy, there is a group of people, new parents, who are influenceable in terms of their infant feeding choice. So our interventions shouldn't just focus on those first few days of life. We need to move back up the stream and think about what we're including in education, in terms of our society, because pre-pregnancy, people will choose how they're going to feed their baby before they even think about getting pregnant. So we need to put interventions at each of those corridors in there. And I'm just going to go through the strategy refresh steps so far, just to give you some confidence that what we're doing is comprehensive. Next slide. So first of all, we're going to introduce the scope of the strategy, because infant feeding is a relatively broad term. If I said infant feeding, you might think about, introducing solid foods, vitamins, etc., etc. So you'll be thankful to know we're going to try and take as wide an approach as we can, very much focused on breastfeeding, but also responsive bottle feeding, also on Healthy Start, also in introducing solid food at the right time, because again, we do know that if you introduce solid food too early for an infant, that has a really large implication on their health in the short, medium and long term. So all the NHS guidance would encourage is after 6 months, introduce solid food gradually and then carry on using breast milk for as long as you can, ideally up to a year and beyond. What we have done first and foremost is looked at the literature. So this isn't a new problem. Since the creation of formula companies, this has been a global issue that many health researchers have looked at. And this is a summary of the barriers. Why is it, if we ask mums, because we can't ask the infant because they're a bit too young to respond at that stage, what is the reason why you wouldn't choose to breastfeed or you couldn't breastfeed? And so these are just some of the indicators that came out pretty clear. And the next slide shows the enablers. And the next one is the enablers. So what are the things which are stopping people choosing to breastfeed, and what are the things that are helping us? Because when it comes to designing the intervention, we obviously want to work on our barriers but maximise our enablers so we can fundamentally get more children to be breastfed as possible. And we're not encouraging breastfeeding at the expense of bottle feeding. There is no judgment on any infant feeding specialist in this area. But we do know the rates in terms of health outcomes, in terms of the positive physical or mental well-being impacts on the child and the mum is huge. It really is. You're talking about hospital admissions, so it has system benefits. There's real positives around neurological development. So the best formula in the world cannot recreate what breast milk can do. A couple of key findings. Clear all of them. Yeah. That's it. One more. That's it. One more. So we've then looked at our data. So what is it about our data that tells us where our target audience is? And what our themes are showing is the younger the mother, the less likely to breastfeed. Ethnicity has a big impact as well. And unlike some of our indicators, we've got hypertension rates, actually are white ethnic groups who are least likely to breastfeed. We also see a big correlation in terms of deprivation. That perhaps is not so unsurprising at all. So deprivation, so young, white, more socially deprived parents are less likely to breastfeed. But there's also really strong correlation between skin to skin. The mums or the dads, if the mum might potentially be having a lot of medical treatment at the time, straight after birth, skin to skin has a really big positive impact on whether you're likely to breastfeed. And as does antenatal visit, which is obviously really positive for us. And then what we have also then done is then looked at not just our barriers and said, well, everyone in Medway is the same group, but a lot of those barriers and enablers come from studies all around the UK. So we've gone out 2 months ago, in the last 2 months, we've been speaking to our young, white, more socially deprived families, asking, well, what are your most dominant barriers? And this is going to be really helpful when it comes to informing our strategy and our interventions. And you'll see it in your pack of papers, but where it's got a plus on there, that's naturally something which is going to be a really key driver, and the negative is thing that's going to be a disabler. So they're really important in terms of us addressing those enablers and barriers to saying, well, what's important most to our target audience? Think about those 35% of infants that aren't receiving breast milk, because if you segment your audience, there'll be some people that are going to breastfeed no matter what. So actually we don't need to focus on that group. It's actually those that aren't breastfeeding the ones that are most influenceable. And what we have done from looking at that data, looking at insight work, I had a really good focus, a workshop with a number of clinical professionals, commissioners, peer supporters, digital experts, communications experts, and we're working up a strategy, and this will be ready for your guys' input at the end of this month. It's just written up, and we're working on 6 goals. First one is provide best possible care, understanding our target audience, making sure we understand that 35% more and more, promoting the benefits of breastfeeding, ensure residents and professionals know what support is there. It is, we've seen that from the insight, people just don't know what's there. Normalisation and promoting the breastfeeding, not just to mum, but also to the wider support group. It's not just one person's influence. And then recruiting more support to this group. And there's individual interventions underneath that action. So there'll be an action plan that follows a strategy. So the existing interventions will continue. We'll have detailed resource implications. We're using some of the Family Hub Start for Life money to fund the infant feeding specialist team in those first 40 hours of life. And we'll be coming back with a strategy and implementing the actions. I'm trying to do a couple of slides on obesity because obviously one of the key inputs and one of the key impacts on having low breastfeeding rates is a high obesity rate. And we do have a whole system BC program, so any new counsellors, new members who may not be aware, the accountability for that. So I chair the Healthy Weight Network. Vicky Broom, my colleague, is a whole system BC officer that coordinates that work. And we have a very clear governance structure, and the infant feeding strategy group sits underneath that. We have a Medway food partnership. We're bidding for Medway to be a sustainable food place. We have a physical activity alliance, and we effectively report our progress to the Health and Wellbeing Board every year. And fundamentally, if I asked the question now, if we did a Menti poll and I said, what's the reason for obesity? What are the causes? What are the things you could do to reduce it? You'd all have a really good example. I'm sure you might say walking to school is really positive for children's health. You might say we have got too many hot food takeaways. And none of those things are wrong. So I tend to use a jigsaw puzzle analogy. But this diagram is perhaps the best one when it comes to any behaviour change. So if the behaviour change we want to elicit is more breastfeeding, behaviour change is more cooking, healthy ingredients, or more physical activity, as a system, we need to create the capability, opportunity and motivation. If I have those three things, if I'm capable to walk to school, there's a good chance I'm going to. If I have the opportunity to cook healthy ingredients, there's a good chance I'm going to. If I have the motivation to take part in regular physical activity at the weekend, there's a good chance I'm going to. But if you take one of those elements away, you don't get the behaviour you want. So when we think about our whole system obesity programme, we always think about these three elements across a wide range of interventions and sectors. And what we do have, if you want to know the full range of interventions, because we have a pretty good, well-stocked list of interventions. So Vicky and the team, one of their key roles is going out, they're finding about the yoga class that's happening in St Mary's Island, finding about the Walk Into School programme, finding about what schools are signed up to the Daily Mile, and we log them on this whole system BC dashboard. It's open access. You're very welcome to go and have a look at it now. It is, although it's open access, it's a professional website where we look, and what we're looking for is gaps. What we look at is there no healthy interventions in Twiddle? If not, what can we do to go and find that? So this is our gap analysis tool, but we put it in the public domain so that you can have a look at it. And this is our trend line. So what we're looking at here, Ailish mentioned some of the data, and you see that horrible blip on the sort of two dots in from the right. And obviously that's the COVID pandemic impacts, and that just goes to show the impact of children not being in education, the impact of children not being able to play sport, the impact of children not accessing healthy eating in schools. But even before that, just look at that sort of gradual creeping trend line. The dark line is the England trend. So Medway's been hovering in and around the England trend for some time, and this is our year 6 data. So me take-home message is the last endpoint. We're a little bit above the England average there, so we really need to do a lot of work with our school-aged children to try and keep bringing obesity down and follow the trajectory we have. But there is other indicators beyond obesity. It's not just about obesity. Again, just like breastfeeding, it's not because it's a problem immediately. There's lots of proxies we also measure. And the reason I work in this area is because things like physical activity are just so positive for a child's health, family's health. And you can see we've actually had some good indications of data showing our kids were pretty active last year compared to the year before. So there is some positives in some of our challenges. And we got some really big achievements. So if I gave you a whole presentation on the great achievements of the whole system BC programme, you'll be here till tomorrow. So just some quick highlights. Very, very excitingly, we've commissioned Food for Life. They've got a whole school food programme. We have our first academy that's achieved their bronze award. And that's a bronze, silver, gold award. And we've got 20 schools signed up already. And we're looking for 25 schools next year and 25 schools the year after. And this just shows they've got excellent growing eating projects. And we have commissioned this programme through the public health grant. So we'd love counsellors to go to their wards and ask your school, are you signed up to the Food for Life programme? If not, get in now because we're looking for the next 25 schools. Please do sell it to them. This is an offer which is commissioned by us and is a fantastic support package. We've also had our Medway Can Healthy Weight campaign, major success over the last few years. If I was doing this presentation just over a year ago and I was asked what's the biggest challenge, I would have said schools engagement. But the education providers, schools particularly, and nurseries and preschools have been amazing in the last year. Over 75% of schools have taken part in a healthy weight initiative in the last year, which is amazing. We had a physical activity campaign, and they managed to go around the world themselves, log in their miles on our website just in 4 weeks, which is incredible. And the winner was actually a nursery and preschool, which I was quite surprised because the children got little legs. So that's pretty impressive. The next one, our Healthy Weight membership, is at an all-time high. We'd very welcome all members to be on our Healthy Weight Network newsletter distribution list. Vicky will send you a nice update every season. We send it about 4 times a year. Just give you an update on this is what's happening. And we got a Healthy Early Years Award. So just like our schools, we got a Healthy Early Years Award for nurseries and preschools, and we got national recognition. The team went up to London a couple of weeks ago and recognised for the great work we're doing there. They're just a couple of the examples. But fundamentally, we want to keep seeing those reductions that we saw the last year, and I'm hopeful for this year's data that will be out in November. It's a once-a-year record done for Year R and Year 6. And my final slide, we'll be bringing these to Health and Wellbeing Board for ratification, but you guys can see an early headline for them. But we're looking, as our 3 subgroups I mentioned for the network, Medway Food Partnership. We are really excited and really want to make Medway, generally put Medway on the map for food, and Medway to be awarded the Sustainable Food Places Award. The closest area to us is Brighton, so we'll be the first area in the southeast, apart from Brighton, to achieve this if we can. And then we work our way to silver and gold. And that is a fantastic award run by Sustain, showing we've got sustainable food, tackling food poverty, all the core ingredients that represent our food partnerships. So it's a great framework for us to progress on. We want to increase the reach of our Physical Activity Alliance, bring more people together who are motivated to get people, children, adults moving. And I mentioned we want to get our info-feeding strategy across the line. I think that is our presentation. So we'll happily take any questions on any of the content.
So Councillor Campbell, got my eye first.
Thank you. Thank you for that presentation. It was some wonderful initiatives there and some great statistics and achievements, and brought back memories for me that involved conversation about breastfeeding, some very painful memories. I have a question around that, actually. Peer support, in-person support, seems to be quite key in improving breastfeeding take-up rates. So I went on the website, We Are Beside You, is it, yeah? To identify what local support there might be. And looking at the map, it's quite patchy in terms of where people can go in person to seek support, especially when it comes to drop-in sessions. It seems to be more about booking by appointment. But also, there's a couple concentrated around Rochester, Chatham, there's one in Gillingham, but there are entire patches of Medway where there's no in-person support, say, like Cliffwoods and All Hallows and all those places. So is that something, is that something you're considering in the refresh of the strategy, and what are you doing to address that?
Short answer is yes, you're thankfully to know. So recruiting peer supporters are volunteers. So any of you work with voluntary sector groups will know that volunteering just generally has been harder over the last couple of years, post-COVID, cost of living, whatever the reason for that. So whether it's a local football club. So we have been the last sort of 2 years as being harder. We've got probably about 8 regular peer supporters at the moment. We definitely want more. So Medway Community Healthcare do a good job coordinating those peer supporters. And it is part of the Family Hub Start for Life guidance as well. I've actually got a meeting next Friday to think about bringing some incentives. So rather than paying peer supporters, we're looking at incentivisation, so reward them to attract more and get more peer supporters to carry on working with us, because we have the breastfeeding specialist clinics happening on a weekly basis, but ideally that peer support you get from somebody, whether that's somebody that's experienced the same heart attack as me and talking through those natural experiences, peer supporters are so valuable to other mothers and families, and dads chatting to each other in those groups as well. So yes, that is an ambition, and we've got meetings, and it will be part of that. We're also looking to refresh the Beside You website, to create a Medway Beside You website. We've had a good partnership with KCHFT recently, but we want to bring that website a little bit more up to date in terms of interactivity to be able to find that support better as well.
Thanks, Chair. And just to add to that, and sorry, I'm Director of Public Health, James, just in case colleagues, members didn't know who I was. I think we also need to just remember that we need to put more services in areas where we know that the uptake of or support that's required might be greater. And that might well mean that we haven't got universal cover. And that isn't to say that people aren't able to access those services, but we just need to be clear that if we're going to tackle the inequalities, then we do need to focus on those areas which are currently underserved or where the need is greatest. And that's, again, part of the strategy that we're looking at. But we will try and ensure that we do get coverage across, but there will be places where we will try and enhance the support that's available.
I had Councillor Lawrence next.
Thank you, Madam Chair. Very good presentation. Thank you, Scott. Thank you, Ailish. It's certainly good news that we've got the government funding for the early years care, but I'm pleased to pick up that you're not going to rely on this being long-term, because it's been very disappointing to see over many years now that governments promote initiatives, give local authorities a sum of money to get on with it, and then that money dries up and you have to make the invidious choice: do you take something else out of the budget in order to pay for that, or do you drop it? And that's not a nice position for us as local councils to be in. So I'm pleased that, we are in fully understanding that funding might not carry on, because the benefits of early stimulation and treatment of children is so important. When I was a little while back appointed to be chairman of the Community Safety Partnership, I started to do a bit of background reading as to why young people behaved in the way they do. Why do they get drawn into gang culture? Why are they susceptible to antisocial behaviour? And in later life, why do people rough sleep? And one of the sort of threads that went through the documents that I read, and a lot of this research had been done, academic research had been done in the United States, not the UK, was the effect of adverse childhood experiences on young people. In fact, one of them I remember seeing 2 brain scans of two-year-old children, and from an amateur point of view, you could see from those brain scans that there was significant differences between the 2 young children. And it's a frightening thought at the age of 2 that those 2 young people's lives had almost been mapped out for them. And that's a frightening thought. At the age of 2, probably one of those will end up in prison or dead early. So that is quite a bad thing. Also, I think, whilst some people say, we've got a lot of bad parenting now, I think what we've got to remember is it's more difficult for parents now. When I was a young person many years ago, families locally here in Medway tended to be very much larger than they are today. Also, people didn't move around so much. So there was a support network available to young families, from uncles and aunts, cousins and the rest. Because of our much smaller families and higher mobility, that's a family support network that was there naturally is not so much available. So I think we need to put more emphasis on interventions in there. This is not a case of the nanny state trying to take over the parenting role and help at all. I think it's just giving that support that would have naturally been there in the past. So that's all good stuff. And breastfeeding, well, funny enough, at my age, I'm becoming quite interested, because my wife and I have been, in the last couple of years, blessed by 3 wonderful, great grandchildren. And I'm delighted to say that both my granddaughter and my granddaughter-in-law, being outgoing, confident young women, are very happy to breastfeed in a semi-public place. Unfortunately, a lot of young women do not have the confidence to do that. And I remember we had a scheme a few years ago that we had little stickers up in places that were considered to be breastfeeding friendly. So if a young mum wanted to go somewhere where she could feel the confidence, she wouldn't be stared at and treated as somebody that was unusual. I'll be continuing with that scheme, because I've not noticed any of those stickers around so much. But and as far as healthy eating and foods, that's a very, very big subject. One of the things I was impressed with, a few weeks ago, we had a cookery demonstration in the Pentagon, which showed how it's perfectly possible to have a freshly cooked, nutritious meal that is comparatively inexpensive. And it's not necessary to rely on pre-post processed foods, which are nowhere near as healthy. But one thing also has occurred to me, I mean, something I've had drummed into me from my own childhood, that we always used to use all the leftovers, and that ability to be able to drum up a meal out of what's left over in the fridge from previous meals seems to have been lost. And it's a frightening statistic that I've read, that some 40% on average of food in the household gets wasted. I mean, that's a frightening statistic. And also, we as a local authority have to deal with the consequences of that, of actually having increased volumes in the waste stream. So as well as carrying on with our cooking demonstrations, as I say...
Sorry, Councillor Goldwyn, can I just interrupt? just wondered if we were going to get,
Yeah,
if there was a
so,
question or...
So what I'm saying is that, can we carry on with these demonstration programs, because they've been a really good thing in the past. Thank you.
So the response rate in terms of the breastfeeding friendly venues, yes, that is one of the targets for us. So the Beside You campaign was the sticker there. And actually what James mentioned, we are looking to really focus on venues this year where that 35% of groups that I mentioned that aren't breastfeeding, we're going to really focus on that. So rather than going to your nice coffee shops where you're going to find people that are going to breastfeed anyway, we're actually looking at targeting venues where hopefully that 35%, even if it's before pregnancy, just to make them think, oh, this is normal, this is acceptable, because you're right, that will have a big impact. And in terms of cookery demonstration, yeah, glad you enjoyed the Pentagon event. That was part of our Medway Can campaign. So obviously that was a particular resource campaign for a year to really try and light the touch paper in certain settings, think about that. But absolutely our cookery programs will continue, because if we can get that cooking literacy up, it has a big impact on the environment and on people's health.
So just to check, did Councillor Galvin ask your question, Councillor Lawrence, or no?
Thank you, Chair. He's the leader. He can butt in whenever he wants.
Okay.
Reading the papers, I was just wondering what officers felt success looked like at the end of the 3-year period. I'm also concerned that if the 3-year period started in 2022, we're in 2023, what have we achieved? And I'm hoping you're not going to tell me we've lost a year. So the other thing is how are we going to prevent duplication of services? So there's lots of people offering a lot of these services, whether in the health area, I'm thinking particularly about health visitors, for example. How do we make sure this is all joined up? And in the multi-agency approach, who's in charge and who's accountable for making this work? Because looking at why the ICS is working at the moment, that is a bit of a bun fight of actually getting people to work together. The other thing is, can we please have some record keeping around who is using these services? How often are they visiting the services? So that if we do extend it, that we know who to reach out to. I think there's a danger that these services are accessed by people who might need the support, but actually we miss the people who really need. Speech and language is one of the issues here. We've got a real problem in our primary schools providing speech and language support. Primary schools can't find them. And yet we're now going to be taking more capacity through the family hub. So I'm just wondering how officers are going to reconcile the lack of speech and language in schools and what we're going to be offering through this service. In terms of the childhood obesity thing, I'm struck by the community approach, but what training's been given to schools so that they can have one-on-one conversations with families? Because ultimately we can dress this up however we want, but ultimately we need to have those conversations with individual families and individual children. There is no training provided at primary school level, and the thing about it is when children put on that weight that early, they never lose it. And I just wonder whether officers had a view on whether the body positivity movement is affecting policy. And finally, can we look at the quality of PE provision at junior school level? Are children getting enough opportunities to exercise? What is the quality of our PE provision? And encouraging children to carry on playing sport when they get older. I notice a lot of children, when they get to GCE level, stop doing sport. Thank you.
Okay. I hope I've captured all your questions, but please, if I have missed any, then no, it's fine. So in terms of what success looks like, there are some things that there was the expectation of the programme and some things that we as a authority signed up to. And there's a whole range of things. Some of those things we addressed through the quiz and the presentation. So, for example, continuing to see that decrease in our smoking at time delivery rates, an increase in terms of the breastfeeding rates, but also some things like reducing the escalation from early help into social care services and having more children who are school ready at the point at which they start reception. So there's a whole range of outcomes that we're hoping to achieve through this programme. we have to be realistic about what can be achieved in a 3-year. So about not all of those we will see the impact at the end of the 3 years, but certainly we want to be able to start the bedrock into that, building on the work that we've already done, and then continuing to see that success embed.
So you've got the systems in place to gather that data to prove the project? Because we are seeing a lot more children at primary school level not ready for primary school. We also see a lot more SEND at primary school level. And so I'm hoping that you've built the systems to go out and gather that data to prove the spend.
It's part of the process of establishing this is around the data capture, but some of those are already national measures that are already recorded at national level, and we can then track the trend from the time of this investment of this program going forward. But this is both a DFE, so Department for Health, and Department for Education and Department for Health funded program. I can assure you we will not be getting off light in terms of data capture and being able to demonstrate the impact of the funding, and there's an expectation of what we will be capturing, which includes, addressing one of your other questions, capturing the profile and the numbers of families accessing the support through that program. And so we're in the process of recruiting that transformation team and then getting that data capture established through all of those programs. In terms of, I can't even read my own handwriting now, so in preventing duplication, absolutely that's crucial, and that's why our stakeholders are from across those range of organisations. So this is absolutely not a programme that we've developed in isolation. We are working very closely with midwives, health visitors, as I said, voluntary sector organisations. Even in terms of the perinatal mental health program, we're working with our colleagues in maternity commissioning and KMPT to understand what the offer is around acute needs so that we can ensure that this program is dovetailing into that. So it's absolutely not our intention to duplicate. We're looking to see how we can build and expand on what's already there. In terms of who's accountable, it's the local authority that is accountable for this program. So whilst we're working with that range of partners, and certainly partners within the ICB as well, it is ultimately the local authority that is accountable for this program. And actually, it's Leanne who's the senior responsible officer for this and will be held accountable for the outcomes in the long run, which is why it's important that the governance is through the council, but in a multi-agency forum, and therefore, as I said, it goes through the Early Help Partnership Board, which is chaired by Leanne, but has a range of partners from the ICB and other health organisations and police and a broader range of partners around the table there. The SALT issue is absolutely crucial. The speech and language issue is absolutely crucial. It is one of the reasons why we were really keen to be able to get this funding, because one of the challenges is children not being identified or getting that support earlier, then attending school when there hasn't been remedial action put in place is putting that additional pressure on our specialist services. And so what we're looking to do through this is not use specialist speech and language therapists, but actually train up a voluntary sector organisation to be able to deliver a support programme to parents to be able to put early and remedial actions in place. And I can't remember the name of it, and my colleague Glenn will be trying to send it to me telepathically, but there's an evidence-based program that we have signed up to that will deliver that support at that earlier intervention. So it's absolutely not trying to recruit from the same pool and put more pressure into the system. It's about being able to put early interventions in place, and our ultimate aim is to take that pressure off the specialist services in the long run by intervening earlier. I think I have answered all your questions, but please let me know if there's anything I've missed, but I'll let Scott pick up on the obesity.
I'm really glad you asked the question about training, because this is a fantastic opportunity to promote something which we'd love all members to know about and be part of. So we have a full range of free training. Most people think, where's the catch? There is no catch. We use a public health grant because we believe that drop a pebble in the pond and the ripples would go out. So all of you could become Better Medway champions, and that included our Better Medway Champions training, and I've just had a quick Google of it. So if you go on healthtraining.medway.gov, the next training we have around talking about weight with confidence is on the 21st of September, 9:30 to 12:30, and that's our expert team doing exactly that. how do you have a really difficult conversation with a parent? And there is some very subtle ways you can do it. So rather than say, oh, we think little Tommy's, you know, too big for his age, that's quite a difficult message to give, difficult message to hear, and then you get into that defensive mode. But we train people to talk about, oh, how much Xbox time is Tommy spending? There's really subtle ways you can open that conversation, and most parents are happy to have it. So there is gateway opportunities that are perfect. National Child Measurement Programme, where we weigh and measure all children, so over 95% of children in year R and year 6. So health visitors, school nurses are perfectly positioned to train, and they do have those conversations at that time. But obviously there's lots of year gaps between that. So we would love to train more schools. So if you are working in a school environment, but hairdressers, people who have sometimes the best relationships, faith group leaders. There is some fantastic people, so our training is open to everyone. Please do have a look at it and either book yourself on or encourage more schools. We know schools and education providers are so pressured, so I'm not saying they should do more of, because I'm sure they've got 10 requests today from someone more important than I. And then just in terms of PE provision, it's not an area that we can have too much influence in as a local authority anymore. We through the Physical Activity Alliance, through Daily Mile, through Daily School Mile, through our Medway School Games, obviously there's some bits in there. I personally agree with what you're right. I think Department for Education, we need to look at that PE provision and change the standards and make it more standardised. There is a grant that goes to each school, and it's up to them to choose how to use it. And the body positivity, it's about, some of that's covered in our training, actually. It is difficult. It's a real difficult balance to strike, because a lot of the terminology I have to be really clear about. So a lot of the conversations in adults now is about living with obesity, not an obese adult, because it's that labelling issue in the same way someone's not a diabetic, someone living with diabetes. So you don't want to use language as any sort of barrier. We need to say, what are the opportunities to have that positive conversation about what you want to do, what matters to you as an individual, what matters to you as a parent. So yeah, it's a sensitive issue.
Thanks, Scott. And I'll probably just reflect on 2 points, if I might. So one is, I think it's not just the school. I know that isn't what you're saying. You're actually emphasising the need to look at the whole system. I refer back to Councillor Gulvin with his community safety hat on. Dealing with weight, or a sensitive issue like weight, needs us to be able to walk on the streets and feel that you can go out and use the big open spaces that we've got. Feels that you feel able, so Scott's point about being empowered to do that. We know that children and young people are in schools for a period, but actually the schools cannot be totally held responsible for this issue. It's all of us supporting our colleagues within that particular environment that we've got to work together. And I think listening to Scott's points about having an understanding as to how you can broach that issue, we know there are quite a few clinicians in here. It's very difficult to talk about issues such as weight. You don't want to stigmatise or victimise people who potentially have been through some other issue that means that they might be coping with the challenge that they faced through perhaps not being as active as they may well have wanted to be, nor perhaps eating foods that are high in sugar, high in fat. I bring members' attention to the strategic work that central government are leading on and meant to lead further around formulation. So working with those organisations and food manufacturers to actually reduce the salt and sugar content in our food. So there's quite a lot of things that we need to think about, but I'll just reaffirm it's not just one thing. We've got to move around. And I'll also just go back to the glass is potentially Medway in any event half full. Scott's hiding his lights under a bushel. He delivered the Medway Can initiative that took our community around the world not just once but 5 times. If you look at the trajectory on the strands there, it's not that our young ones aren't being physically active, it's that we've got to maintain the trend, because being overweight doesn't just happen overnight. There's things that occur, and it will take us a little bit of time. That's the issue, to deal with all the broader challenges that we face. But I do think that we're on the right trajectory, and members be more informed and actually coming on, becoming a Medway champion, and using your opportunities when you're engaging with your constituents to signpost people to the support that is available will help us all to actually achieve those targets a lot sooner.
So if I can just say, whilst obviously there's hierarchies of political groups and things, leader of a group isn't chair of the meeting, so if we can stick to the order that I call people in so I can just ensure the smooth running and go through this list, that'd be great. And I had Councillor Jones next, if that's okay.
Yeah, thank you very much, Chair. Thanks very much for the interesting presentation. We've spoken a lot about early intervention, both in the presentation and in the questions that have flushed that out. I wanted to ask about vaccinations. If I go back 20 years or so, even longer perhaps, the Kent County Council experience, those days, we did have groups of parents in some parts of Medway, particularly in Rochester, at that time, who were not getting their children vaccinated. So I wanted to ask for a little bit more information on this. Fast forward to today, is it still an issue? Are there pockets of geographical areas, perhaps, where children are not being brought forward for vaccination? How is it fitting into the parenting skills work that you're doing as officers? And talking to colleagues earlier in the evening, I was wondering whether it might be useful to have something on the work programme specifically about this. But having done the training session shortly before this committee and some of the feedback I got from that, I wonder whether a briefing note on vaccinations might be useful, you know, as to what the situation is in Medway. Is there a take-up issue? Because that can then lead to other forms of support for parenting skills, early years provision, and that sort of wider picture. Thanks very much, Chair.
Thank you for your question, Councillor Jones. So this committee does receive and has received previously reports on the vaccination immunisation programme, particularly on children. So there isn't an issue, Chair, through you to bring back a briefing paper setting those things out. It's quite obvious, and I think you've raised the point that there will be areas within Medway where we will have lower rates of vaccination, and that will be for a number of reasons, a whole range, and we perhaps be able to clarify and give you a bit more insight as to where they are and what some of the factors are when we bring back the briefing paper. We do work alongside, because it's not us that clearly as a local authority that commission those services, but they are commissioned by NHS England, but we do work alongside those colleagues, and some of our provision is delivered by the services that are intertwined with our public health function. Ailish might be able to touch on some of that relationship, but just, you know, in summary, we can probably bring back a briefing paper and perhaps agenda it for you, Chair, and the work plan to go into that topic, because it is quite a big issue, and we would engage with our NHS England colleagues to bring them into this space.
What I will say is absolutely, as part of the Start for Life and Family Hub offer, promotion of vaccination and supporting parents to understand how to access and where to access that will be crucial and integral. It is as part of that parenting support offer, so that a strand that you saw within the programme, and it'll be about how we target those messages as part of the outreach offer that we do, but also ensuring that information is available digitally and parents understand the importance of vaccinations and how to access them. And it is an integral part of the health visiting role as well, in terms of supporting families to access that and understanding why they should get the children vaccinated and how they can do that too.
Okay, if I can call Vency, our Medway Youth Council representative next. Right.
Hello, nice to meet you. Thank you for having us here. Thank you for giving this amazing presentation. We did learn a lot. I wanted to ask, from my experience, which although it hasn't been a lot, I've traveled around the schools. I wanted to ask, you have all those programs which are available to young parents, to carers, to children in this regard, for example, obesity. However, I've noticed that in some schools that either have less funding or there is, I don't know, let's say less interest in regards from the students to speak out about their problems. They're feeling shy, especially after COVID and the mental health sort of provision which has got in. I think we've sort of shied down, I think, and that's influential in everything. are you doing to maybe increase advertising or raising the awareness of those programs? Because they're great. I've read a little about them, yeah, thank you.
So, I mean, getting the message out there is always our biggest challenge. Every time we think we've promoted extensively, we hear back, oh, I didn't realize that program was available. I didn't know that was out there. So, in terms of the Family Life and Start for Hub program, there is specific investment in terms of ensuring that the Start for Life offer is very clear and people and families understand how to access that support. What we're hoping to do is to have a single place, so not having all of the information all in one place, but a single landing page, so that actually if you went there, that might, you could click on a link and it would take you to the relevant organization or tell you where the relevant services are. It's challenging to do, to be able to develop that and to keep it live, but that's what we're working through and that's what some of the investment will be for. But I'm sure Scott will talk about some of the specific programs he has.
Yeah, and it's probably easier to talk specifically because I think that question is a great one because and the answer probably is it depends at the time and on what program promoting. If I'll give you a couple of examples, so our Medway Healthy Weight campaign that I mentioned, could you mention what work we do in schools? So we used a lot of the existing channels the council has. So Celia's team, you got their Headway sort of newsletter that goes out to head teachers, talk about all the great stuff that's happening in schools to keep head teachers informed. That's one channel. We've got officers that go into schools via different routes. We have some great Medway sports officers that go out and engage. So it's about utilising all those different channels. But what if the school isn't interested in that healthy weight agenda? What if that head teacher and teacher isn't a champion there? So we do a lot of Facebook marketing. We invested well over £10,000 in Facebook advertising as part of our Medway campaign, because actually that's one of our key ways of reaching people, and you can segment the audience very beautifully on social media. So you give a certain age group, you give demographic details on Facebook, know much more about me than some of my family members do. So actually, why wouldn't we utilise those things? And then you've got, we tend to use less of the big billboard outdoor advertising spend that you'd like to, because again, the cost per unit of that is quite tricky to measure. So I'd probably say we reach more of our younger cohort through social media advertising, and obviously it's up to us as maybe not so quite young people keeping up to date with technology, but that's why we've got a very good communications team and bring agencies in to support us with that. So it is a multitude, and it definitely depends on our audience, but we definitely use the channels into schools. But that is why we do need members and counsellors who almost certainly know your schools and your wards, just to keep reminding them, what are we doing about this? So as many opportunities you can, if you see our programme, maybe just ask other champions what happens, because that personal recommendation goes a long, long way. People see umpteen adverts every single day, but what's the one that's going to make you, check that behaviour and do something? So welcome your support, pushing it for us.
Sorry. If I can also just add, the other thing that we have is a pretty comprehensive PSHE, so personal social health education, resource and training and support for schools. And we offer that to every school across Medway. And quite often what we find is that a school, if they don't have a particular interest in, let's say, healthy eating, they do have a particular interest in relationships and sex education. So we'll get in through that angle, and then we'll expand across the breadth of the PSHE agenda and be able to support around that as well. So sometimes it's about finding the thing that people will bite with first, and then being able to bring the rest of the program in alongside it.
Thank you.
If I can.
Thank you, Chair, and thank you for that presentation. So I did have a few questions. The first one was actually in regards to your barriers to breastfeeding list. So what about mothers who struggle with their milk supply? So it's not an active decision to say, I don't want to breastfeed. It is really a struggle to get milk supply to be able to fulfill their breastfeeding, the baby's breastfeeding needs. That's my first question. And my second question was in regards to how are you, or have you looked into outside of school activities, especially during the holidays, like during the 6 weeks holiday, where children are probably at home or not doing much. What are you planning to do during those periods? My third question was in regards to speech and language. So have you seen any impact following the pandemic? Has there been an increase in the number of cases in regards to speech and language in the early years? And how are you dealing with those extended wait lists that, for example, nurseries are facing and parents are facing in order to get speech and language therapy on the NHS? Thank you.
Yes, you're right. One of the barriers is whether it be milk supply or other issues, pain, a mother might have had difficult birth. There's some very physical barriers, even if you're the most motivated person in the world. So that is why we have our 2 breastfeeding specialist clinics. So what we mentioned about peer support earlier, ideally want those people with perhaps less challenging issues, just more around the attachment and positioning issues. That's not, something that's physically like tongue tie, which is definitely stopping that infant from feeding. Ideally, we deal with most of the problems in our universal service offer, so health visitors and midwives giving that bit of support. If that person then needs a bit more support, peer supporters. But the breastfeeding specialist clinics happen twice a week now, so we've actually doubled them in the last 3 years. And that's actually because of demand, because people are generally finding more difficult, complicated births, more tongue tie or more diagnosed tongue tie. So that's a really integral part of that. And it's just about getting the right infant and parents to that session, because there are always physical barriers to some people and we need to overcome those. The other question was around whole activity programs. Now, thankfully, Marcus Rashford, wonderful human being that he was championing and lobbying for this. So some people might not recognise it because we tend to use a different brand, but the whole activity food programme is now a national programme. But Medway Go was launched just over a year and a half ago. And last year alone, I can tell you 5,292 children attended whole activity food programme. So Medway Go, you see that. So again, another fantastic opportunity to promote that during the summer. 4-week block, because that's the long period. That's where holiday hunger really kicks in, because that's a 6-week long stint between potentially having a healthy meal every day in school. And some children, Marcus talked about his own story in the press. But Medway Go provision is there, is in every single ward, and it is a universal offer for anyone on free school meals. So, and it's not just about food, it's about those enrichment activities. So 4 hours, 4 times a week for 4 weeks in the summer holidays, and also at Easter and a Christmas break. So please do promote Medway Go as much as you can, because it's just a great opportunity. Me and James went to a couple of sessions in Easter, just watching some children doing some dance activities. That just wouldn't have happened a year and a half ago. Free dance activities with a healthy lunch turning up. Brilliant programme. Please do promote it.
And then in relation to the questions around speech and language, so yes, as I mentioned in the presentation, health visitors carry out a 2.5-year check, and they do the ages and stages questionnaire at that stage. One of the things that they're looking at is speech and language development, and we have seen a small reduction in the proportion of children who are meeting the developmental milestones at that stage. It's why we were so delighted about this opportunity for this home learning environment funding, because what we want to be able to do is be able to deliver an earlier intervention program, and I have the name of it now. Early Talk Boost is the name of the evidence-based program that we'll be delivering. And as I said, it's not about putting additional pressure onto the speech and language services, which we know there's been significant referrals into, and which we know that there's a real challenge in recruiting the workforce around that. It's about supporting frontline workforce and parents to be able to create a language-rich environment to be able to support that developmental delay at an earlier stage. We also ran a campaign last year called Grow Through Play, which again was exactly about that. It was about helping families to have very easy tools to be able to support through play the developmental milestones for their children. And we provided resources and family packs, and also promoted the 3-year health visiting check. So that's not a mandatory check, but it's a check that we do here in Medway, and it's aligned to the application for school placement. And parents can identify if they have any concerns at that point. Health visitors will triage and pick that up and signpost and support those parents into support to address any concerns that have been identified. And through our Grow Through Play campaign, we saw a significant increase in the number of families who then completed that 3-year check.
Thank you, Chair. My name's Robbie Lammas, member for Princes Park. Pleased to be back here on the Children and Young People ONS, which was the first committee I actually started on 2 years ago. I have a comment and 2 questions, if I may. Comment is that I concur with Councillor Galvin that I think your plans for the spending and the 3-year period are really sensible. I think, you know, the money is not going to be guaranteed for the long term, so I think that's really, really good. The first question actually follows on from something that Councillor Annie Machon, is that right? Annie Machon said about school holidays. In Princes Park, I have a playground that needs refurbishing, and I have a little area where I want to build another playground if I can. So my first question to you is, in your opinion, is it advantageous for the health outcomes of the young people in Princes Park to have these playgrounds built, and perhaps that could be something that the Labour administration might want to take up? Second question relates to a point I read about breastfeeding. I was really struck to find in the report that white mothers have the lowest rate uptake of breastfeeding. But of the cohorts of people like BME and others who had a higher uptake of breastfeeding, one of the key factors they listed in the report was religion. So I'm just wondering if that correlation has been assessed by the council. Have you gone into churches, spoken to them, figured out, is it a point of religion, or is it something that they're talking about in church communities that they aren't talking about in other communities that we could mimic as a local authority? Thank you, Chair.
In terms of access to parks and green spaces, yeah, the data is very, very clear. If children and families and adults live near a place, a green space, a blue space, a play space, they're more likely to use that. So whether you live in inner city or urban dwellings, that is absolutely a direct correlation there. So I would wholeheartedly say the system has a responsibility to provide not just access to spaces that are accessible, but places where people feel safe. James mentioned this, the community safety aspect. You might live next to a park or a play area, but if I'm feeling intimidated about walking along that riverside, I'm very unlikely to do that. So we definitely have a role as a system to make sure children can play in those areas. In terms, the link to breastfeeding and faith is actually, it's a strong correlation if you have a faith. So actually going into churches and other faith settings, etc., isn't necessarily it's the people that don't go into church faith groups, because it's the lack of faith which does those things. And a lot of that's because of social norms as well. So certain cultures in some parts, there's some countries in the world with a 99% breastfeeding prevalence. Portugal, I believe, has the highest, 90% prevalence in Portugal, and that's because it's just normal to do. And again, that's not necessarily in certain scriptures and certain faiths, and you have to do this is part of your faith. It's more than that social normalization, people feeling safe in those spaces, likely to breastfeed, and it being visualized as socially normal. So it's the lack of faith that actually links to breastfeeding reduction rates.
I had Councillor Turpin next, please.
Thank you very much, Chair, and thank you both for your presentation. The quiz in particular was very useful, and I think if that's something that we use going forward, I think it will definitely encourage us to read our papers in depth if we know that we're going to be named and shamed up there on the screen. So, yeah, that's a good one. I just wanted to talk about the sort of infant feeding, the breastfeeding. As I've probably mentioned before, I mean, I was a breastfeeding peer supporter, so very, you know, it's dear to my heart, that. And I know you sort of was talking about getting in there early being very important, and sometimes people's sort of concept of what they're going to do when they have a baby can be different to when the baby arrives. So I think getting that support in there early is crucial. And I'm just wondering if we've looked at sort of peer supporters going into, and obviously there'd have to be sort of permission and things, but into sort of antenatal appointments or being referred from their antenatal appointments. You know, they sort of move on from the midwife to a peer supporter and have a chat at that stage. I mean, I know when I was a peer supporter, I was speaking to mums while they were pregnant, and you know, it wasn't just about them coming along with their baby. So I think that would be something, I don't know if that's been looked into more. Also getting into hospitals, obviously midwives are really stretched, so sort of getting that support when, you know, they've got a newborn baby, they probably would welcome some help from some volunteers. And I think if you've got a peer supporter, you've got a lover of a newborn baby, so they will, you know, they will run into the hospitals to go and do that if they can go and be, you know, with a newborn baby. I just also wanted to just ask about sort of what volunteers we've taken on over the last sort of couple of years. I think I was probably the second cohort, and I know there's been a third. I don't know where we are from there. I was at that time when it went from sort of in-house to MCH, and there was some issues with the transition, and we lost some volunteers in that period. So just wondering sort of with the governance of that, you know, obviously we're the ones being judged on the performance. How are we overseeing how well MCH are running their volunteers? And looking at that, and you mentioned about the reward, sort of having a reward scheme there. I think something that would be really welcomed by volunteers is actually feedback, and that would be a reward in itself. If you're giving your time, you know, and it's often, you know, very precious. If people know that their time is being put to good use, and there has been, you know, positive outcomes from that, I think they'd really welcome that, and that would keep them on track and engaged. Thank you.
Thank you, and thank you for your time and your peer support and that has such a big impact, as I've already mentioned. You'll be really pleased, hopefully, to know. So Ailish mentioned that 16% of the budget for Family Hub Start for Life needs to be spent on infant feeding. So what we've chosen as a group would be our best use of that resource is to try and tackle some of those challenges that you mentioned, and in one fell swoop, because you've got really busy midwives, you know, stretched workforce, you know, uber tired. We know how difficult it is working in a clinical setting at the moment, and we're struggling to recruit volunteers generally, and including peer supporters, because people need to return to work sooner, etc., etc. So what we're going to do is what we've discussed with Medway Foundation Trust is investing that money to recruit a specialist team. So an infant feeding specialist team that are on site 24 hours a day, 24/7. So as soon as baby's born, a really busy midwife who gets the call saying difficult delivery, they've clearly got to go and prioritise a difficult delivery. No one wants to see anything negative happening to a mum or an infant, so they can go off. But that specialist infant feeding person is only trained to do that work. So then they spend that time getting initiation, getting attachment, doing all the conversations that a peer supporter can do. It would obviously be a more kind of junior entry role than a fully qualified midwife. But I'm hoping that will not only provide an immediate service to the 3,500 deliveries, Medway deliveries that happen at Medway, as well as the Swale mums in addition, but it would also provide an opportunity for the peer supporters to see a paid role they could work towards, and those infant specialists might then go on and be a midwife. So it adds another kind of rung to the career trajectory of people working in that field, which I think can only be a really positive thing. So, yeah, we're working with Medway Foundation Trust to work out the proposal. There's a couple of hospitals that have done it. Southend, we've been speaking to learn what their model is, and one of the South London, might be Croydon area. So the two infant feeding leads are fantastic. They've been up and seen that to see if we can make that model work. Then obviously we need to overcome the issue around sustainable funding for that. But perhaps being a bit biased, I'm very confident if that has a really impact, that'll be absolutely, prove its worth, and doing a really good evaluation project showing that that small investment in that small team, because it's small comparable to the impact on the clinical input. And you mentioned about peer support incentives. So I've got Sharon, who coordinates the peer supporters group, to ask our peer supporters currently what would be the incentives that they would perhaps know. And actually top of their list in no particular order is, in order, is training for themselves. So they feel that they're building their competency levels. And then it was around days out for families, et cetera, and volunteers paid for, and some more incentives. So we've asked those peer supporters, I'm going to use some of that resource in year to try and incentivise that work. And as you say, so that transition, I can't remember the number off the top of my head because it changes all the time, so peer supporters come and go, but it's just under 10 at the moment, and we have a cohort that's trained each year, and we just need to keep working with MCH to provide that as much support as possible, and the governance for that is Ailish and the team obviously manage that contract, and it's part of our KPIs and commissioning processes, whereby we ask them that question, what we do and what can we do to support. And it's not a commissioning provider relationship where we tell them what to do and how to do it. What can we do to support you so we can get as many volunteers peer supporting as possible?
Great, thanks, Chair. Thanks for the presentation. I echo what everyone said. It was really good to do the quiz and have a really detailed presentation, so thank you. Just wanted to say that people have asked about how this information gets to schools, and I know that, Scott, you came to one of our zone meetings a few months ago in terms of presenting this, so that does come directly to us face-to-face as well as head teachers. one of the things I want to talk about, and I really appreciate what Councillor Lawrence started the discussion about about school support, and everyone said it's not just the responsibility of schools, which is great. But I want to just think about school just for a moment. Is there an impact on academic attainment of children who may be coming to school at reception obese, or maybe children who were exposed to smoke, the statistics you said during pregnancy? Is that data that's tracked by us as schools? Is it by the local authority? So you know the children that come in reception, how they achieve during, say, reception baseline as they progress and achieve of SATs and beyond in terms of that health aspect. That's one question I've got. The second question is just regarding the asthma statistic you had. And I just wondered, is there I mean, I work in Rainham, and there's signs in Rainham saying if you're stopped at the lights, turn your engine off. I just wondered, is that a bigger Medway approach in terms of a concern about vehicle emissions and maybe what the impact that has on either getting asthma or children who do have asthma? And my third question is that I've written this several times, and it's going to come across complicated still, but all of the initiatives you've got are really good. And I'm just wondering, that were all those initiatives done in light of the data that was presented on the quiz, or was it done due to previous data and therefore the data has improved that was shared in the quiz? I think hopefully that's clear, that final question anyway. Thank you.
I'll take 1 and 3, and then I can do number 2. In terms of data indicating academic attainment in terms of health, a healthy child achieves more academically. A school-ready child achieves things more academically. That's no surprise there whatsoever. There has been national studies looking at obesity specifically, and again, children living with obesity are unhealthier. So guess what? There's some academic attainment there. And perhaps one of the most important aspects, though, is not necessarily the obesity per se. It's the two massive things which impact our body weight. What we eat. Food is the fuel, so, and I'm not talking about to eat a salmon fillet before exam, because that's the thing that makes you clever. A child without enough energy will not learn. So healthy eating is a massive, excuse the pun, ingredient to academic attainment. We have to get that right. And a child that moves, again, oxygen going through our bodies. What we see all the time is schools, head teachers who courageously commit the time to do the daily school mile, and might not be a whole mile because they might have really little kids, go out and do that. And all the time they report us, the children are so much better behaved after they've done that, because guess what? They burnt some energy. So the old ways are sometimes the best ways continuously. So a child that moves, that eats healthily, is likely to be overweight, likely to be a healthy weight, and is therefore likely to achieve academically. So thanks for your support in the schools over the last year, because it has been integral. And I think we're really getting there with schools. I think the message is really clear. I think they've seen the graphs and think, 40% of children are leaving school overweight or obese, primary school. That's far too many. We need to do something about it, and we can do that. And they're just one of the vectors for doing that. Do you want to do number 3?
Number 2 in terms of, okay, so if I pick up the question around asthma. So there's quite a lot of work going on across Medway and Swale in terms of asthma and trying to reduce the number of emergency attendances. What has been identified is that there are some children whose asthma management plan is not as robust as it should and could be, and the support that they're getting through primary care is maybe not as robust as it could or should be, in some cases because of training and expertise within the primary care setting. So there has been an asthma specialist nurse recruited to work across Medway and Swale, and the consultants in the hospital are doing outreach work into primary care settings to be able to support and ensure that the management plans are quite robust. In terms of that program, one of the other things which you might be interested to know about is that they are looking for schools to sign up to become asthma-friendly schools, and some of that will include the air quality around the schools itself, working with parents around idling cars and ensuring that that isn't happening, but also about staff understanding of asthma, family understanding, and managing asthma sensibly and well. So there's quite a significant amount of work specifically going on around asthma, which we would love to engage with schools around, and happy to have further conversations about that as well.
And you asked a question about are we data-led or not? So what we talked about here, none of this is particularly new for public health, and there's a lot of work in the NHS system which we massively welcome around a programme called Population Health Management. I think it's public health by a different title. We've always been data-driven. So fingertips is, there was a question here about vaccination, so I just quickly went online, pressed 3 buttons, and I could see what our vaccination rate was for MMR in the last year. So data-driven is effectively the same thing as public health. So I'll give you one example of why we've been data-driven and what we've done. So Ailish mentioned the fall in our smoking in pregnancy, time of delivery rates. That is because we noticed a problem a number of years ago, and we've implemented interventions such as Bump Club, been working with training with midwives, sonographers in order to do that, and our maternal smoking strategy, you can judge its success by the trend line. It's lower than it's ever been. So I like to think so, and obviously the more capacity we have, the more we can deploy our capability.
Hamilton, please.
Thank you, Chair. So my question is more about the initial phases of the development of the Start for Life programme and the infant feeding strategy. Can you confirm that those programmes were developed using a gender lens? I'm very conscious that a lot of this focuses on the mother here, and I want to know to what extent a gender lens was applied in developing the programme and the infant feeding strategy.
So the programme guide is very clear that this is not just about mothers. Of course, mothers are at the centre of it, but when they're looking for us to develop perinatal mental health support, breastfeeding support, and the antenatal classes, they are talking about this being mothers, fathers, co-carers, the family around the child, and supporting the full range. So our engagement to date has been with Medway Parent Carers Forum, which admittedly, I'm sure Lisa will challenge me if this is incorrect, is largely represented by mothers, but there are fathers represented within that group as well. But our next stage is develop that parent-carer panel, and we're very clear that that parent-carer panel needs to be representative of parents across Medway, and it'll be that'll drive our work going forward. And also we're we've just commissioned some insights work as well, and that insights will be looking into all cohorts of parents to help us design the needs and understand what needs to be done to address it.
Just have a follow-up question on it. So in terms of looking at things very practically, access to the family hubs, how are you going to ensure that where there are both parents, but both parents will be able to equally access that? Also with peer support groups, how are you going to ensure that there is balance and that it's not reinforcing gender inequalities and another generation where particularly young girls face gender bias growing up? So that I'm really conscious that it's a difficult area to look at, but how are you going to monitor that? How are you going to address it if it's not pulling in the results that you're looking for?
So the monitoring will be fairly straightforward, because we will be monitoring the parents that are coming through, and we will be monitoring the demographics of that, so gender, ethnicity, age, to be able to understand if it's representative. I'm not going to propose to you how we're going to do that at the moment, because I think it's the insights that needs to inform that and tell us why are some cohorts not accessing the support that others are, and what do we need to do, how can we make that more accessible? That's what we'll be using the insights to inform us.
And sorry, one last follow-up question. In terms of the infant feeding strategy, where is the focus particularly on encouraging fathers to engage with the promotion of breastfeeding?
Yeah, so I mentioned some of the insight work we've done. So the literature review is very clear, and there's some really nice barriers and enablers which talk about that wider support around the infant, not the mother. It's the infant that's recipient of that. And a lot of that talks about a really supportive unit. And that's why when we did our focus groups, we did 2 focus groups and 12 in-depth interviews. We made sure at least half of our interviews were other people around that mother. So we interviewed 6 fathers minimum, and there was grandparents, because they also play a big role. And it might not be, the normal family unit, 2.4 unit, the grandparents, aunties, uncles. So it's absolutely clear. And that's why when we develop the brand Beside You, it was always try not to make it a focus, and there's a bit on the web page there around what can dad do, what can parent do, what can your support thing. You know, it might be same-sex couple parents. So it's really appreciating that we need to support the infant, and it's modelling that infant. There's some really clever stuff where some really good stuff that Midway's Health has been much more around focusing on the infant and what's the support mechanism around there, and that's not just good for breastfeeding but all the other factors.
And then
hello there. First of all, my apologies if I've missed something. There's a lot I couldn't hear and a lot I couldn't see. So first of all, regarding your presentation, is it possible that I could have a copy of your slides in black and white and not in colour, please? There's a reason for that. My main question is to follow on from what Councillor Lawrence said. I'm particularly interested about exercise, sports in schools. If I was going to say that I don't think this is something that can be overemphasised. It's not just about obesity. Obviously, obesity, healthy eating, but also it's about your emotional and your mental well-being. If it's taught correctly, then it can help with things like respect, discipline, and a can-do attitude. Now, when I played rugby for Wanstead High School, we had a relationship with an adult rugby club in Bancroft in Woodford. It helped me as a teenager to be able to just step into an adult environment club, and I carried on playing for 20 years and enjoyed a lifetime passion for what is actually the best sport in the world, which is rugby union. Thank you.
It sounds like a statement, not a question. Totally agree with you. There is a, sport and physical activity and movement is so much more. You can be healthy weight and unfit and unsporty and not moving regularly. And it's not just about sport, it is about those movements. So yeah, totally agree. You can learn a lot around self-discipline, martial arts, walking, Nordic walking we're running at the moment. And I think, yeah, there's many schools that really know that and appreciate that. And we're trying to get that not just in schools, but nurseries and preschools, and going on beyond children. You know, how much this activity can we build into the daily lives of people living in care homes and care settings. I think it's absolutely integral, but I'm an exercise physiologist, so I would be slightly biased.
So I've just realised I didn't even ask the question, sorry. I wanted to make that point. The question was to extend to what Councillor Lawrence said. Can we actually have data? Do you have data of the relationships that schools have with sports clubs? Is that something you would be able to get hold of or to request?
So schools tend to be attached to school sports partnerships. We've got 2 school sports partnerships, Greenacre and Howard School. We don't have access to that data, but for our Physical Activity Alliance, most of those people are coming through. So we could tentatively ask that question, and those that don't, we could try linking them up. If that sounds okay. We don't have the data because it's not our remit, but we could definitely ask that question, which schools would like to have that link, because our Physical Activity Alliance members are growing. We've got some fantastic sports clubs in Medway, the Medway Rugby Club, Gillingham Corians Football Club. We had a presentation from Frisbee Tennis Club. There's some really good clubs, and I'm sure they'd want to work with more schools, so we can take that point forward.
Yeah, it'd be fantastic if you could have a neighbouring role. So I'm going a little bit off remit. I was executive manager of a youth centre way back, and the work that we could do getting kids off the streets. So I know I'm straying into antisocial behaviour and attitudes and the rest of it, but it's all linked. So if we can have some kind of information that we can identify and then work on, that would be great. Thank you very much.
Okay, and then I had a...
Yeah, I've forgotten what the original question I was going to ask, but it's been so long. But thinking about actually what Scott said in terms of healthy eating, I'm thinking about my constituents and the people I meet daily, and with the food banks they're visiting and the difficulty they find in providing nutritional food for their children, given the economic conditions they've been subjected to. It's about that behaviour model you're looking at and how we can provide provisions within that model. I know at the front end you put in a lot of money and investment into the programs of the interventions, but I'm feeling for my constituents a lot of it's about the capability side, about getting to those events or getting to those workshops. In terms of motivation, there needs to be some sort of incentivization where mums are working harder, dads are working harder, coming home a lot later due to the economic situation at the moment. So there needs to be more incentivization, provisions provided for the incentivization side. Are those being considered? Are we putting too much money at the front end into interventions and not into enough into getting people at these events and maintaining the programs at the same time? That's my question.
So many of our cookery aspects, so part of our Medway food partnership has 4 key primary areas we want to work on. Food poverty, healthy eating, reducing food waste and oral health. And it's a bit of an anomaly where people think, well, surely food poverty is the absence of food and food obesity is, too much food. They're so interlinked. It's incredible to see that. And it's about that kind of, energy dense, unrich nutrients, lack of food literacy. So our healthy eating cookery campaigns, we try and take to, family hubs, we try and take to as many places as possible. So it's not necessarily about us running one big event in a central place. So if you have a look on our map and you want us to kind of look at how we can provide that, as long as it's a facility and it's just a space, we can demonstrate those things. So quite often, actually, as you say, it's about that motivation to attend those sessions. It's not necessarily our ability to provide them. We'd happily turn up at any church or community group and do some cookery demonstration. And I'm talking about little stuff like we have a thing called, touch it, lick it, taste it, eat it process for children who've never seen a pepper and going through that process. So we'll happily do all those things. So if there is a space and provision, we'd happily bring those rather than waiting for people to come to us. Incentivization around behaviours obviously is it's a challenge, but something we perhaps we do need to consider as we move through. There's lots of work around incentivization, cash incentivization to get people to pregnant mums to quit smoking. But that, there's a big leap to kind of doing those things, and that would take a big conversation with administration and talk about what we can do differently if our current rates aren't working. James, probably got more to add.
Thank you, Chair. And just a reminder for all members that as a local authority, we hold the Household Support Fund, and constituents, residents can actually bid in to that, and you can get up to, I'm just looking at our list, it's on our website, you can supermarket vouchers, food, energy vouchers, paid the utility costs, and referrals. So you mentioned, didn't you, the issues around the transport bit, so that they can get some of their costs offset, that might be able to maintain them and go off to some of the activities that you reference. And, you get £200, £210 per household, depending on the number of people in your household. And that isn't a one-off. People can reapply for that particular pot. The bit that's got referenced is where we put on activities, and if we're talking about the holiday activity fund, transport links are available to those families and children that are eligible, and they don't have to pay for that. So that can, but I do get your point, which is the day-to-day cost of living challenge that we've got. And I know that from the new administration, new leader, that's one of the focus that the administration have placed on the officers, and we're responding to that.
Thank you. So I had just one final question that was for Ailish, and it was, so obviously I wouldn't be here if not for the Sure Start thing, so this is a really exciting prospect, the family hubs, and I wondered how we can use them to help reduce caseloads, because we've got the social workers, so how we can reduce caseloads in early help, because I know it was mentioned in there, but there wasn't much kind of detail on how that would be.
Thank you. I mean, it is absolutely one of the outcomes of the programme is about how we can prevent that escalation. And part of that is about how we upskill the workforce to be able to deliver parenting support strategies. So we talked about the Triple P and the Incredible Years programme. And part of it is about I guess, supporting parents themselves at that universal level to be able to meet the needs of their children and families through the peer support programs, but also through a really robust antenatal program as well. I get that fundamentally it's about how we come around these families at the earliest point to be able to support them to meet the needs of their families. And there will be a whole range of training that will be available to upskill the workforce, but also it's about the integration. So how health visiting, midwifery, social care, early help are co-located within a place to be able to identify those needs, have those conversations, and think about how they can use the full support network to be able to meet the needs.
So if there's no more... Oh, sorry.
Just a quick question. Currently, the NCMP isn't commissioned for special school pupils or pupils who attend independent settings. Therefore, that data isn't being tracked and potentially support not offered. Is that commissioning decision something that's going to be reviewed as part of this?
The National Child Measurement Programme is a nationally mandated programme and nationally set criteria. I'll have to go away and ask the question to colleagues at National Group to ask if they're reviewing it. They do review the programme annually, so they look at things like the letter, making sure it's worded appropriately. But I can ask that question specifically and get back to you if that's okay. It's a nationally set programme.
Okay, and yeah, if there were no more questions from the floor, if I can pass to the Vice Chairman. So there's no...
Thank you very much, Chair, and an extremely interesting presentation and discussion it's been. And the interactive quiz was quite an innovation. I shall be working on my skills between now and then and rising to the challenge that Councillor Turpin has set, strive to push the buttons even quicker next time. Having said that, I move that we note the reports on family hubs and Start for Life programme, infant feeding strategy and child obesity reports from the Public Health Department.
Okay. And is that seconded?
Yes.
And agreed? Thank you. I'd also just like to quickly thank the officers for their time in the presentation as well. Brilliant. And then if we can move to what was item 5, and that's the Medway Youth Justice Plan, which is being introduced by Ken Dance.
Hello everybody. My name's Kenneth Dance. I'm the manager of the youth offending team, and I'm introducing the Medway Youth Justice Strategy. Every local authority has to have a youth justice plan. It's a requirement under the 1998 Crime and Disorder Act. For the last 2 years, the National Youth Justice Board, who set the standards for youth justice across the country, have stipulated the requirements of the plan. This year, they've increased the headings and the areas that the plan needs to address. They've introduced 10 priority areas, which I've outlined in the plan. The motivation for doing that, I think, is the priority that youth justice as a theme has in government, and the desire that there is more oversight from the centre of youth justice services delivered locally. Just looking at what those themes are that the plan is, that have been set. So it's children from overrepresented groups, prevention, diversion, education, restorative approaches and victims, serious violence and exploitation, detention, youth custody, and the use of remands, and the use of custody and constructive resettlements. So those are areas that the National Youth Justice Board are requiring Medway to have a plan about and to report back on. The way that they've asked local authorities to undertake the plan. It's somewhat more like a service review. The guidance that they issued for us to complete the plan asked us to report back on those headings whilst also making actions for how we're going to improve our performance in relation to those headings. So that's the background. I'm presuming that people have looked at the plan, and I welcome members to give any questions that they might have about it.
If I can...
Yes, thank you very much, Chair. I have read the plan. My comments are going to be probably less on that plan in terms of it's going to Cabinet on the 11th of July for onward transmission to central government, and trying to get an understanding of youth justice issues generally. I'm a returning member here, but a lot of members of the council are new. And I think what would be valuable, and at the moment I'm not really getting my head around how we might do this, but I welcome views from officers. I was looking at the Youth Justice Board introduction and the various angles that were mentioned, mental health, emerging from the pandemic, specific communities or parts of communities. I would like to have a little bit more information on Medway as a total place, how the youth offender team interacts with probation, how the secure unit fits into the general picture. I'm almost thinking of a task group, but you know, if the directors present want to discourage me from doing that or advise against, obviously I'll listen to that advice, but I'm almost thinking that members might wish to get their head around this in depth, you know, if the youth justice team manager were up for that. So no specific questions on the youth justice plan to go forward to Cabinet and thereon, but I do have a concern that we need to get a wider picture of these activities. Thank you, Chair.
Thank you for that comment. The area you're speaking about is really outside of the realms of this committee. It sits more with community safety in terms of your question about task and finish. This plan is a statutory responsibility and we need to keep it to the narrow requirements. So that's what we need to focus on this evening. I'm sure Ken will answer that part of your question, but in terms of your broader comment, it sits elsewhere.
I mean, just on the bit about members' interest, we have in the past had an open evening to members that we invited members to. So, you know, we will do that again and make sure that people from this meeting are invited to that because we welcome all of your interest. Sorry, the question, could you repeat your question about the plan again?
I'm sorry, I had no specific question about the plan. It was to get my head around that wider picture. I accept the director's advice. I do think the idea of a member's visit to youth offending team is probably the way through that, and I'll certainly talk to colleagues about taking up possible task group elsewhere in the council. Thanks very much.
Thank you.
Thank you. Thank you, Ken, for a very comprehensive report. I noticed the report shows that you've got an open road substance misuse worker, which is based in the North East London Foundation Trust. So, Ken, could you give me some indication of how that works in practice? I'm particularly interested in that, given the substance misuse among young people here in Medway is such an important issue. My next question is, I very much welcome the appointment of a CAMS worker to the yacht. However, the threshold for accessing CAMS is actually quite high. So I was just wondering what other mental health support can be given to young people through the yacht. And finally, this is not a question, it's more, I'd like to make a suggestion. I noticed in the report that yacht hasn't had a police officer seconded to it since February 1922, which is somewhat disappointing. I'd like to make the suggestion, and if the Vice Chair could take this up, please, that as a committee, we write to Superintendent Rob Marsh and request that, I make the suggestion that perhaps an officer from the Medway Task Force would be very suitable to take on that role, because the Medway Task Force is its whole ethos is multi-agency working, and they've got huge knowledge and connections across Medway, and I think they're working alongside yacht would be a really good mix. So, thank you.
Thank you, Councillor Govan, for your comments. In relation to substance misuse, for most of the young people we work with, cannabis smoking is normal. We have very high rates of children who smoke cannabis, and the impact on their motivation and aspiration by regularly smoking cannabis is there. It can cause significant problems with children's motivation. So whilst we have a substance misuse worker linked to the team, there is a current commissioning exercise going on to increase the capacity and the time of a substance misuse worker that we have. We're looking at having one in the team for 2.5 days rather than just to link in with the open road young person substance misuse team. And I really welcome that, because most children don't question their cannabis use. They don't want to have it questioned. It's not until they meet someone, they start a trusting relationship and they feel that they can start questioning it, that we see progress being made there. So that's in relation to substance misuse. In respect to CAMS, the provision of a CAMS nurse in the youth offending team is a real boon. I mean, you can see from the figures there, from our case closures, that there are significant issues in relation to emotional and mental health for the children that we work with. And so every young person that is open to the youth offending team is assessed with a national standardised youth justice assessment tool, and that has a screening, an emotional and mental health screening. So any children with items identified on that screening will be referred to that CAMS nurse. So we're out of those thresholds. So it's a premium service to children that really need it in terms of the impact of their behaviour on the community. In terms of your suggestions about the police officer, I mean, the Medway is launching a child-centred policing team that's come on board this month, I believe, and we're waiting to see what our links are with that team. And there is a national discussion going on regarding the police officer role for youth offending teams. The College of Policing was due to issue it last month. We're still waiting for it. What support, a document with detailing what support the police should provide youth offending teams. Once we have that, we'd welcome any support in terms of discussions with the police to make sure that we do get that support from them, because the cohort that we work with, we really need the full police engagement.
Yeah. Thanks, Ken.
Thank you.
Thanks, Chair, through you. And just to reaffirm, as Ken sort of described, at the last Youth Justice Board meeting, we did have a really insightful and formative discussion with our police colleagues who set out their plan to reshape this. So from our perspective at this moment, I think the police have come forward with those proposals to give us the support and deliver the outcomes that we've looked for within our plan. But clearly there's a national piece, but at local level, I think we've been assured that the police are giving us the support that we need and are responding in line with the requirements.
Thanks, James. That's reassuring. Thank you.
Councillor Minishon?
Thank you, Chair, and thank you for the quick summary, Ken. So I had two questions. So I note that the grant allocations for 2023 and 2024 have not been confirmed yet. So if you do not receive all the funding expected for 2023 and 2024, is there a mitigation plan in place? For example, areas that will be prioritised or other means of funding? That's my first question. My second question is also, will you be introducing more youth centres in Medway? And again, if that's not this committee, please let me know. But this could obviously avoid loitering, antisocial behaviour, reoffending. So I'd be interested to know what you have in place for that. Thank you.
Thank you for those questions. In respect to the grant allocation, we don't know what it is yet. We're normally told in July, some point, we submit the plan and then they give us the grant. So it seems a bit the wrong way around in terms of planning and finances. The National Youth Justice Board have given us an assurance that there will be an uplift from last year's allocation. So we know what last year's allocation was. And that assurance has been in respect to the introduction of key performance indicators, these 10 priorities that are included in the plan. So we are not expecting we're not planning to mitigate in that way. We're not doing that. Your observation about youth centres, that's not my area. Medway is very lucky to have a proactive youth service, and Roy Smith, who is the manager of that team, can speak better to the work that they do. But the plan does allude to the important role that the youth service has in terms of diversion. It's that work, that detached youth work, the work that the youth service does around young people involved in antisocial behaviour, particular areas, it's really key. Because by the time they get to the youth offending team, if young people's offending is an expression of other problems in their lives, and often when we get them, those problems are quite significant. Thank you.
Councillor, regarding the youth service, it does sit with this committee. The youth service is under the stewardship of the Assistant Director for Children's Social Care. At this current time, there are no plans to increase youth centres, bricks and mortar, but there are lots of plans around other forms of youth work, detached, special projects, that sort of thing.
Sorry, I just had a quick follow-up comment. Just because I do recall when we were speaking to residents, that seemed to be quite a big issue, the fact that there were a lack of youth centres within Medway. And when I'm going down the road, I do see youths hanging out, not necessarily having anything to do, and I think that might help the community quite a bit.
So if there's no more... Councillor Lawrence?
Thank you, Chair. I was just interested in the restorative justice aspects of the reports. And does that have an impact on reoffending with the young people who take part in the restorative justice? Second question, this is the first time I've seen anything like this, so forgive me if the answer is obvious, but is the type of crimes young people and the severity of those crimes changing over time? Struck by your comment on cannabis use, and I think that might be a warning to those that would legalise the use of cannabis and what impact that might have on offending. Thank you.
We don't know whether restorative justice has that kind of impact. I don't think that would be the kind of qualitative data that would be needed to bottom that out. I don't think we have. However, we do have many, many examples and case studies of when we have brought children together with the people that they've harmed that we know have had a dramatic impact. And as a team, we are very deeply committed to restorative practices. And for our court orders, for any young person sentenced to us from the court, we will contact those victims, and they will have a voice in the kind of intervention that is undertaken with the young person. And it's a victim-led service, so it will be their choice entirely as to whether they interact with that. But many do, many choose to. And often, you know, we see very beautiful instances of victims participating and expressing their concern for young people. And you know, it's a very powerful area that we're absolutely committed to restorative practice. In terms of crime changing over time, you know, that's a huge, big question, and I think the police would have to provide data about that. But certainly, from our own data, we've seen an increase in knife crime, in the possession of knives. That's been a steady increase over the years. And as I'm sure you're aware, the phenomena of county lines and criminal exploitation is prevalent in Medway. That county lines travel through Medway, and we work with many children affected by that. And the complexities of working with children who are involved in that are enormous. I think we have to develop very, very trusting relationships with children for them to tell us what their experience of being criminally exploited and being involved in county lines is. But you know, I think the yacht plays a really important role in that work. You know, we work with a lot of those children, and they are some of our most difficult children to work with.
Councillor Shoker?
Yeah, thank you, Chair. I don't think I saw it in the plans, but does Oasis Restore fit into anywhere into these plans going forward, or is there any plans to do any co-partnership with them?
We are in ongoing discussions with Oasis Restore about how we can work together on projects in the community. One of the things that I think you'll see in the plan is we deliver a lot of work and community work for the children that we work with in the community. So, you know, that could be a possible area of where we could work together. But the fact that Medway has 2 secure establishments for children and young people within its boundary is a significant issue, but we, you know, the numbers of children that we have in those establishments is small. I think you can see our custody figures over the last year. We had one young person in custody. We've had a few more on remand, but we've had one young person sentenced to a custodial sentence in the last year. Those establishments are national establishments, and all the children in there have their youth offending teams from whatever local authority they come from working on their resettlement plans. So I don't think those children impact on this community, but in terms of the resources that Oasis Restore could bring, we are in discussions with that. I know Leanne's in a lot of meetings with Oasis Restore.
And Councillor Turpin, please.
Thank you, Chair, and thanks very much for the report. I just had a couple of questions. Just looking at the youth offending team on page 10, I think it is, of the plan. I just, and apologies if that is there, I see that the posts, are they field posts? So are we got vacancies there, or are we struggling to recruit?
My apologies, what page?
10, I think. It's 10 of the plan or 21 of the agenda.
And so what was the question? Which might be vacant?
I just wanted to know if they're, because it shows the structure there, but if they are actually all field posts. Or
Oh yes, they're all filled.
They're all people in place.
Yeah, no, we're well resourced at the moment.
Yeah. Okay, thank you. And just a couple of other things on sort of our position, sort of how that's changed nationally. So with sort of first-time entrants, that's sort of changed negatively in Medway, whereas national picture has improved, and although sort of reoffending rates have improved, they haven't improved as well as they have in other areas. So I just sort of wanted to look at why that is, and I think you've touched on that with sort of things we're seeing. And is that a geographical thing? Is it our sort of proximity to London, or is it much more complex than that? But you know, what are we seeing different here in Medway that other areas aren't?
I would love to be able to meaningfully answer that question, because those first-time entrance rates and the reoffending rates, you know, are of significant concern for us. The problem that we have is that the national data that comes from the Youth Justice Board doesn't come down with case data, so we can't identify those children and look at their risks and needs. We do assessments, very detailed assessments on every child that we work with, so we could, if we could get their names, collate that data and understand that cohort much more. We've had an information officer in post for 2 years now, and what she did as soon as she started was collating our local reoffending data. And in the next quarter, we're hoping to start reporting back on that. So we will be building up that picture. It's a priority for us. I mean, clearly, reoffending and first-time entrance is what a youth offending team is meant to be about addressing, stopping young people getting in the system, and once they're in the system, preventing them from offending. So we, you know, I can assure you it's an absolute kind of data priority that we're looking at that. But we don't know it just because that's how the national data works. I think I could speculate a lot of things about why that might be, but I don't think that would be useful. I think we really need to do that piece of research over this year.
Okay, so Councillor Spring.
That didn't work. You mentioned about prevention, and two of my fellow councillors already, again this evening, mentioned about the impact of community hubs, youth centres, etc. But is there also an invitation sent out to schools for students to participate in sports? Because, and this leads to what we spoke about earlier as well, about the health benefits of sport. Is there an invitation sent out to schools to invite students to participate in sports or the arts or any other social activities in order to try and prevent them from going into crime and stop them from, for want of a better phrase, hanging around on streets and causing antisocial behaviour? Is there something within our plan under that may help us?
Perhaps I can answer that, Councillor. So the context around this plan is it's specifically about the remit and the statutory requirement that we've got to produce this plan. I think you make some great points, and as I'm hearing as well, other members are providing insight as to what else we can do as a system, but we do have as a council a sports strategy that looks at those kind of elements, which is not really within the remit of this plan, but it's a broader strategic issue. So as an authority, we do those things, and we have got a dedicated sports team who run a whole range of activities and interventions working with our schools. I mean, Scott's gone, but he did mention this, the school sports partnerships and the way in which they work, but quite clearly, I do know from first hand that where practicable and possible, there are those links made for interventions that read across. But just to reconfirm that we have got a separate sports strategy that deals with those kind of issues.
And can I'll just add as well to that we've got the youth service we've got that we've talked about earlier on, and that sort of question about youth centres. We've got a lot of our capacity in that youth service is diverted at trying to do detached youth work with children, young people out in the communities. So they're out there engaging. We've had lots of projects running, like the railway project, where we've got workers down those places and spaces where we know young people go and there might be risks or issues, and they're out there trying to divert those young people, engage them in activities, bring them into some of those youth spaces and connect them into other things. So there is a lot of activity that's based at really trying to drive those things.
Okay, so that does bring us to the end of the questions for that bit. So if I can hand over to the Vice.
Just by way of clarification, through you, Chair, Councillor Golvin indicated he wanted me to move something about the police. Is he now satisfied that that question has been addressed?
Yes, I think I am. I think the answer I had from James, but of course, I think we'll have another bite of this because I'm sure this report will come to the Community Safety Partnership, and if by that time that issue hasn't been resolved, perhaps we could raise it through that forum. But thank you for that, Councillor Jones.
Okay, well, thank you, Chair, for that. That's been, I think, a very useful discussion. Particularly the questions around mental health, I think, were useful at getting a picture, because we were talking about child health as the first item on this agenda. So thank you for that. The Youth Justice Plan, of course, is a statutory responsibility for approval at the Cabinet. So I move that we note the Medway Youth Justice Plan as set out in the supplementary agenda and appendices 1 and 2, Chair.
Okay, and is that seconded?
Yes, I second.
Okay, and agreed? Perfect. Thank you. Then if we can move on to what was item 6, which is the Council Plan Performance Monitoring Report and Strategic Risk Summary, which is presented by Leanne Farrick and her colleagues. Did you want to add anything before we open it?
I'll speak to it. Thank you, Chair. So this evening we've had the overview of Medway Child Health Agenda, and you've had the opportunity to scrutinise. The other part of the work of this committee is around performance, and that's why you have the Council Plan Performance Monitoring Report and the Strategic Risk Summary for Q4, so that's January to March of this year. The easiest way to do this is for me to hand over to the responsible officers who will speak to the red, because the reds are the ones that, you know, are most worrying. The reds are probably the ones you've got your questions around. If officers speak to that and then you have other further questions, it's easier to take it like that, because officers are likely to answer some of the questions you may have. So, Chair, if that's all right with you, we'll deal with it like that.
That's fine.
Okay, so James first, and then Donna, who will do children's social care as well as education this evening, because the Assistant Director for Education and SEND has had to leave.
Thanks, Leanne and Chair. So, members, the public health measures, PH17 is the red breastfeeding initiation. We have given you an overview as to the action plan, what the challenges are for us and what we are doing to address the particular performance areas. I did mention, or at least it was mentioned by Scott, One of the challenges that we've seen within that space was the impact of COVID on midwifery and their ability, because of a whole range of issues, to support breastfeeding parents when they're actually in that setting. But we are now moving through it. You've been given an overview as to the actions. Happy to take any questions or further clarifications required.
Hey, Councillor Goulburn.
Thank you, Madam Chair. There's two reds that stick out in my mind. There's probably others that colleagues might want to comment on. The two I've got is ILAC 6, and the question I'd like to ask, what are the factors behind the 21% quarterly increase in the rate of children in need? And the other one is EDU 3B, which is the percentage of persistently absent from school. In that latter thing, there is quite a dense sort of summary of the action that is being taken, but it is very, very dense. And given that absenteeism is such a strategic issue, which bears on to some of the stuff we've been talking about, with Youth Justice Plan and other things, I wondered if we could have instead of go through it tonight, just have a more detailed briefing note on that. So those dense sort of list of things, of actions, so we as members can have a better understanding of it. So rather than go through that quite long list tonight, I think a briefing note might be the better mechanism to deal with that. Thank you.
Thank you, Councillor Goulburn. I'll pass to Donna, because in terms of Donna addressing some of the red targets, I think she will answer your question.
Thank you. So I won't be able to talk in detail for Celia's part, but certainly the attendance was one of the things she left me a note on and said about that persistent absence remaining a priority in Medway. We're working with our DFE advisors to develop an attendance action plan. That work's underway. That is cross-directorate as well. We're working across because that affects lots of children. It's fairly new work. We started that, I think, in March, and we've taken part in the DFE Attendance Alliance groups with Kent as well. So based on the monthly monitoring, the DFE, 78% of schools in Medway, we're seeing an increase in attendance, and this is now over 90%. However, persistent absence isn't improving. So, and then I'll just address Celia's other one, and then I'll do the children's social care after. And if there's any questions for Celia's part, I'm happy to pick that up and take that back with her. So her other one was on exclusions, which you'll see is also not where we want it to be, remains lower than the South East and national for our exclusion figures. For the academic year, starting in September, we've had 27 permanent exclusions, representing 0.2% for the quarter and 0.06% for the academic year to date, meaning we won't hit our target for this measure. Almost 27 of those exclusions have been from secondary schools, and one school accounted for a third of them. So there's work underway to support that inclusion agenda, and currently reviewing the alternative provision system in Medway to support that earlier intervention and prevention work that we need to do. So if you're happy for that, then I'll move into children's social care, which have you'll see more challenges, I think, around our data this quarter, and more targets that are into the red that you'll see, and which fits into your first question, really, was the ILACS question. Because broadly, what we're seeing is quite an uplift in need. So across the system as a whole, we've got more referrals, more contacts coming into children's social care, more families asking for support or needing support and help, more issues of concern, and that's led to an increase across the whole system. So more children in need, inevitably, more referrals, more Section 47 inquiries, more child protection, more children in care. And consequently, in a nutshell, that means that we have more work, more children that need allocated social workers in the system, and then that means that those children's caseloads add up to the social workers, and they have more work to carry, so more children's cases to hold, and then that creates the pressures you're seeing around our caseload targets, ILACs 1, where you can see that's red, 28.2%, 28.9% against a target of 22, so higher than we want it to be. So the whole system's under a bit more pressure, and it runs across the whole of the system. So some things where, like ILAC 3, where the work's not as timely as we want it to be, it's because social workers are holding much more work. It's much more of a challenge for them to get things through in a timely way. So if you've got a lot of assessments, getting them all done is more challenging. Getting them done in 45 working days is more challenging. So if you work through, the same as ILAC 4, another assessment measure, again about timeliness. And then if you work through ILAC 5, long-term fostering, I think that probably that target is not one to worry about, because if you look at that over time, we're probably not far out where we think we should be. ILAC 6 is your child in need. We've got more children open across the whole system. And ILAC 7 is our audit. But you'll know, I think I've talked about this so many times, perhaps not to everyone here, but that's a long-term measure. It's going to take us a long time to get good and outstanding in 80% of our work. It's a really long-term trajectory. But positively, although ILAC 7N, which is still in there, is still red, actually we're moving really quite well in the right direction. You can see that's 71%. 2 years ago, we had less than 20% of our work requires improvement. Now it's 71%. That's a massive shift. So although it's not yet good, it means the work isn't all inadequate like it was, which is really important because that's the stuff we worry about. And then just taking you on to N23, which is another measure we've got there, that's about the vacancies that we have. And that's, you'll know, a national challenge. All professional staff, whether you're a nurse, a doctor, a teacher, or anything else, we have the same challenges in social care, but some really significant ones. There's 5,000 less social workers in practice today than there was a year ago. 5,000 less of them registered across the country. We're struggling to get staff to want to come and work because there's so fewer of them nationally. And so, not as a surprise, our permanent workforce is under more strain. So that was a bit of a whistle-stop tour, but if there's any questions, I'm happy to pick them up rather than giving lots of detail.
Okay, so we open for questions. Councillor Lammas?
Thank you. It's just a follow-up question on EDU 3B about the persistent absence data. It says that one of the things you guys want to do is capture intersectionality across different pupil groups, including SEND and people with EHCPs. Presumably that data is already in the hands of the local authority, i.e. which pupils are being absent from schools already. Just wanted clarity on that. And is that a suggestion that a lot of this data could be made up of basically special needs kids being persistently absent because their needs aren't being met? Is that hinting at that? Do you know any more detail on that measure at all? Thank you.
I don't, Councillor Lammas, but I will undertake to get you that answer from Celia. Some of that is quite technical, and I don't want to put you wrong, but I will note your question and get the answer back to you.
Councillor Campbell?
Is that working now? Yeah, thank you. So I have two questions. One is around the exclusion rate that we just spoke about, where it says a third of the exclusions come from one particular school. So that's quite worrying, and I just wanted some context for that data. Is this particular school, is this a repeat offender on this performance measure, this school? Also, is this one of the schools where the Ofsted inspection rating is that it's inadequate, or what's the background for that particular school and that data, please? And I'll go back to my second question later.
I'll answer that. There's an ongoing concern with the school. I am not able to answer your question around Ofsted at the moment, but you've certainly established the link there. When I'm able to do that, I will get back to you, but there are ongoing concerns with the schools. Officers are working with that school, and that's all I'm prepared to say at this point in time.
Okay, thank you. My other question is around the Healthy Child Programme, which is on page 45 and 46 of the agenda. So there's a list of training courses provided for the child and young people workforce. It looks like a fantastic series of topics to train people on. My question is, what is the size of the children and young people workforce? And the reason I'm asking is, in total there were 73, I think, professionals in the quarter that attended these training sessions. How does it compare with the entire size of the cohort of CYP professionals? What I'm asking, I suppose, is it's a great resource to provide, but is it being utilized fully? Is that good return on investment to, for that many people attending?
So in terms of Ailish sort of set that out a little bit. We commission health visitors and school nurses. So the Healthy Child Programme is part of that universal service that gets delivered for that cohort. In terms of the actual numbers, I'll come back to the committee with the number of staff that are employed by MCH, because we don't employ them directly. This is a commission service. But in terms of the outcomes, as you can see, they're delivering good outcomes for us and performing well over and above. And we've been really fortunate to retain the health visitors in that team. Members will be aware that this service is one that is currently out for consideration for retender, and we've got to complete that by next year. So we want to retain that service. We've got a good relationship with the providers, which is Medway Community Healthcare, hence you've seen the data there. But in terms of the actual numbers, I'll have to come back to members and give the actual number of health visitors that are employed in that service.
Thank you. Just as a follow-up, I guess, thank you for agreeing to come back to us, but I guess what I'm asking is to consider whether this service is being fully utilized. If not, what we can do to kind of increase the take-up for it, if you like.
So it's a universal service and it's offered. So the context is we cannot require people to attend if they do not want to attend. Clearly, if there are other issues that we can do something about that. So that might be safeguarding or other things like this. So I think I'm trying to answer your question in relation to the fact that it is offered. It is high performing. You're asking whether we can do more. Clearly, there is always more that we would like to do. And actually, the key point for me is, are we actually reaching into those communities, which is what Ailish was describing about the other things that we're adding on with the Healthy Start programme and that type of thing, to make sure that those people who are not accessing those services are appropriately represented. I can't answer your question any clearer than that, I'm afraid, because I haven't got the ability to come back to you directly with the performance data. But what I can say is that from my understanding and from when I look at this programme, it is reaching into the areas where I would want it to be doing in Medway. Can we do more? We always can do, but it is a high-performing service at the moment.
And Councillor Minichon?
Thank you, Chair. So it was just a one question, just going back to children who are persistently absent. What actions are being taken in regards to their home situation, their parents? Are we looking deeper into what could potentially be happening at home, whether that's a sick parent, whether it's a single household and the child may be taking on more responsibilities than a child maybe from a two-parent household is taking, and that might potentially be impacting their education? Thank you.
The answer to that is yes, and it comes in a variety of forms. It may be the school itself who's responsible for obtaining and monitoring absence, so they have the ability to refer that child, that family, through to our family solutions, early help, or an educational psychologist. If you're going through the EHCP route, or if it's a safeguarding issue, it will go straight through to children's social care. So there is a good network wrapped around that. Sometimes, and you're quite right, parents' situation may require additional support, and I'm very confident that those services and support from Medway Council staff are in place.
And then I've got a final question from Councillor Turpin, and if you can be really brief because we're over that time.
Yeah, thank you, Chair. Yeah, it's fairly brief. Just going back to the ILAC 7, the N in particular. I know we've spoken on this at previous committees, Donna, but I just wanted to, it concerns me. 71%, could look good, but that's 29% that's inadequate. So that does really worry me. And I know you mentioned about sort of it has improved a lot, but it's saying here sort of the long-term trend is deteriorating. So that kind of confused me on. Is that mistaken here, or what that long term means? How long is long?
So it's not deteriorating. We've just done a really big piece of work to look at how practice is changing over time. So we've gone back to when the audit started post the inadequate inspection, and we've looked at trajectory over the last 2 years to see what's changing. We've looked at it in every area of practice, and what's very clear is that the inadequate work, so in 2020, which was when the programme started, 2021 when we got proper concrete data, from there to now, so we've just done the work, back at the start of 2021, I think over 80% of our work was inadequate. That's a broad way. It's not particular areas. It's 80% of the work that we looked at and audited at that time was inadequate. And now that work is much less. That work is sitting, I think, somewhere between 13% and 20%, depending on which part of practice you look at. So it's radically less worrying than what it was. What you're seeing here is that you're only looking, that ILAC 7 measure is focused on good or outstanding. Now, good or outstanding, even really good outstanding local authorities struggle to get 80% of their work good or outstanding because there'll always be parts of things, sometimes that social workers can't manage themselves, sometimes it'll be about the care package that is delivered by a range of agencies. There's a lot of variables in things. So that you'd be expecting to get to that really solid good. It's a 10-year improvement journey in a way from being inadequate to getting to really solidly good. So that's a long-term measure for the future. And the ILAC 7N is trying to say, rather than focusing on only good and outstanding, because that's where we want to be, but we're not, it's going to take us time, it's saying, let's look at what requires improvement, because that means the work's not inadequate. It just means we need to do a bit better to get it where we need it to be, if that makes sense. And that's saying that 71% of that work requires improvement, but it's not saying the other 29% is inadequate, because there'll be bits of good in there as well. So it means that our inadequate is less, radically less than what it was 2 years ago.
Okay, sorry, can I just come back to that? Because it does, in the description, it does say the percentage that are graded requires improvement or higher. So surely there is good and outstanding within that. So I would look at that as 29% is inadequate.
Kent County Council, you know that their children's social care was recently judged outstanding. It took them 12 years to get to that place, so it's not a quick fix. It is never a quick fix. It's an incremental moving towards, and I think that target is there in large part around aspiration and Medway's Council's aspiration to have an outstanding service for its children in due course.
Sorry, it's taken me a moment. I could send it out to you, because actually it's quite an interesting graph to see, and probably one you want to see, because you can see where we were here. So inadequate work was up here, and you can see the trajectory over the 2 years. It's quite an interesting picture. It tells you something we haven't been able to articulate till now, so I can send that out to you and you could see it. And I'd be more than happy to have a discussion, as you know, because I talk about ILAC 7 most of the time. So...
Yeah, thanks, Donna. I think that would be really useful, because I think this maybe doesn't, I don't know, it doesn't show the detail. And I think all members here we appreciate that you don't get from, inadequate to outstanding, overnight. It does take time. But I think it's just the worry that potentially shows 29% as inadequate, which seems a really high figure still at this stage. So I appreciate there might still be some required improvement and moving to good, but it's just worried about the 29%. So, yeah, more detail on that would be helpful.
I'll offer to bring it and put it up on the screen for you next time and show you, because it's always a question at every O&S. So the next one, when I do this, I can put the picture up and talk you through it. How about that?
Sorry, Councillor Campbell, through the chair, I've gone in and got the data. So the context is that the Healthy Child programme is delivered by a skill mix. So we've got 37.2 full-time equivalent health visitors, another 8.4 community health nurses, 8.87 community nursery nurses, and 11.56 school nurses, and X number of school staff. So it's a holistic team that all focus on different aspects of that Healthy Child programme. And the way in which they're modelled is that we use mapping to go down to low super output areas, so we can break our communities down into small clusters, and they align their teams to work at that level. So that's how you get the equity of provision across the patch.
Thank you for that. Doesn't quite address my question, though. I think it was specifically around the number of attendees at the courses targeted for the workforce. And the children and young people workforce must be, given that you're including charities and statutory services and everybody. That was my question. But I am quite conscious of time. It's okay if we can take this offline. That's all right.
I found it now, so I'll talk you through it just very quickly. So it just gave me a minute. So in April 2021, this is of the audits we did, so that we only do a proportion of auditing in every quarter. So of the audits that we done, 63% had been graded inadequate, and 37% had been graded requires improvement, and we had no good at all. And as today, well, as the end of March 23, because that's our last quarter we took, we had 29% graded inadequate, 62% graded requires improvement, and 9% graded good. And if I just talk you through when you think of an audit, if you're thinking in its whole way, there'll be different parts of that where practice is more of a worry or less of a worry, or a bit that falls down. So it might be one part of a whole child's journey and a whole piece of work, rather than everything's wrong. So just if you think, if I give you a little couple of measures underneath it, it's a bit more powerful. So in 2021, same time, When we look at our assessment work, which is a really important part of what we do, because that's about how we understand what children need, we had 70% of our work graded inadequate. And today, or March 2023, 2023, we had 72% graded inadequate, requires improvement, and just looks like 13% inadequate in our assessment work. And then if you look at our direct work, so that's where we go out and make connections with children and we're working with them and visiting, 60% of that was inadequate in 2021. And today, 13% of that work is inadequate. So someone may not have recorded something well, like that might get inadequate, but actually nearly 47% of that work around direct work is good. So that's a radically different picture. When you think about that, so it's quite a complex picture you're looking at. And I know we've got a data session what we've offered to do, and we can cover audit in there, a bit of a training session around that, because it is a little bit complex sometimes, I think, for people to understand. So I'm happy to pick that up in there, and that would...
So I did agree an actual final question from Councillor Lawrence, but if you can try and be brief and in both question and answers, that would be great.
I can be brief. The Ofsted framework for inspection changed from September of last year, and a number of schools that have been inspected under that framework have seen a downgrade, including some of our most high-performing schools. I just wonder what the risk is that as more schools are inspected under the newer framework, that more will be downgraded. The other thing was that on the Attainment 8 score, there is a wide range of difference in Medway between high-performing schools, such as some of our grammar schools, and some of our more low-performing schools. So whilst that is a green, I'm wondering what work officers are doing to look at the underperforming schools to make, to ask questions about attainment. And actually, if you look at Progress 8 scores, some of those are pretty dire in some of our schools. I think it's nice to see it's green, but it could be a lot greener based on, just moving some of our poorer performing schools up a little bit. Just one more comment, and it's just really on the persistent absence data. For all of us who are governors or involved in schools, you will know that if you get an outbreak of chickenpox, all of a sudden your persistent absence percentages go ridiculous. What schools really need to be focusing in on, I'm sure officers are doing this, is those children that are persistently absent for any reason, not just looking at a score on a page. And to be fair, I hear a lot of criticism about the attendance service. It sort of checks out in the summer. Everything restarts again at the start of the school year. So children get through a school year, they're persistently absent, we stop taking action in the summer because it's the summer, and then the clock restarts again in September. And I think we need to look at that service and make sure that it's doing what it's intending to do. There's just one more point, it does link, is that children who are in the care of the authority, their persistent absence is a lot worse. And some of it is because of the attitude of social workers who don't put being at school as a high enough priority. Now, that is changing over time, but I do think in terms of social worker training, children need to be at school. It's an absolute priority. It doesn't matter, we're already taxing and busing a lot of children into school, but I hear anecdotal evidence of social workers making excuses for children not being in school, and they actually should be in school. Thank you. I did have another point, but I'm not going to make it. Thank you.
Thank you, Councillor. Can I ask you to hold those questions, because the next theme of this committee is around education in schools, and the questions that you raise will all be dealt with with that theme. It is green at the moment. I can pretty much assure you that none of Medway's social workers have that sort of attitude. None whatsoever. Education and attendance at school is a top priority. I don't know about children who are in care of other local authorities. I'm not sure what's happening there. But Medway, we have a very robust commitment to children who are in care of Medway's authority getting to school and attending school. So I'm not ducking this, but all of those questions that you raise on the green target will be picked up at the next themed committee.
It's unfortunate for me that I'm a substitute, so I won't be there for that themed. So I just wonder if maybe those questions... I don't want an answer now. Fine. Do that.
So if I can move to the Vice Chair for the recommendations, please.
Chair, as has already been said, the acoustics in this room aren't brilliant. I understood it to be the case that the People Services Directorate presented both reports 6 and 7. Am I correct in saying that?
As far as I'm concerned, 7 is for members to ask any questions around risk. It is a very full and detailed explanation around those risks. So if members have particular questions, I'm happy to answer them, but I am not intending to speak directly to that report.
Okay, well, just in case then, Chair, for the moment I'll just move the report 6, the Quarter 4 2022-23 performance against the measures used to monitor progress against the Council's priorities and to note the amended strategic risk summary as set out in Appendix 2. I move that these be noted.
Okay, and is that seconded?
I second.
Okay, and agreed? We can move to what was item 7, which is the People Directorate Risk Register Summary. Leanne indicated she didn't want to speak to it, so just if there was any other questions on it. Councillor Golvin?
Yes, thank you, Chair. I'm referring to DRO 5, which is the failure to deliver the high needs budget recovery plan. I just hope we're not being overconfident in this, because we're moving the risks from B2 to D4 with the control measures in place. That's quite a substantial shift in the risk factor. What gives you the confidence?
Are you talking SR39, Councillor, please? Yeah. Medway is part of the special safety valve funding from government. There is substantial government support currently for our special education needs and our high needs block. I am confident at the moment through monitoring that this is as it is said. Thank you, Councillor.
If that was all the questions, then I'll pass back to the Vice Chair.
I move that we note the report, Chair, and we look forward to future reports being kept up to date. Thank you very much indeed.
And is that agreed? Seconded, sorry.
I second.
And agreed. Then we'll move on to the work programme, Stephanie.
I have nothing to add at all, Chairperson. Just to point out that I will be circulating the presentations from this evening. And also there is a slight error on the draft budget on the work programme. It should say 24-25 and not 23-24. As you probably noticed as well, we do have a data workshop session that's scheduled for July. The date that we have in the calendar at the moment is the 26th of July. It will be a Teams meeting, so it's not in person. We're proposing that it takes place between 5 and 6, and it will be an opportunity for us to look at the performance data sets that will be set out on a monthly basis. So you will start to receive data, dashboard data. They are confidential and just for this committee and not to be shared outside of the committee. So the meeting on the 26th will be an opportunity for officers to kind of go through some of the information that you'll be receiving on a regular basis, and so that members can get a better understanding of the information that they've been presented with. And it will just be on social care, the meeting on the 26th. That's all from me, Chairperson.
Do we have any questions on the work programme? Item 8. I had a really quick one, I was just checking, which was just whether we could add something on the youth service and youth programme into that.
I think we can take that up in a pre-agenda meeting and discuss it and see how we can bring it in. But I'll speak to Donna about it as well. But we can have a discussion about it with the chair and the opposition spokes as to how we can put that into the work programme.
Okay then yeah, that does bring us to the end of the meeting. I'll just pass to the Vice Chair to read that. Yeah.
Well, I mean, we see this as a movable feast. You know, there will be things added to the work programme, but for the purposes of this committee, we're being asked to note the report and agree the work programme as set out in Appendix 1 to the report, subject to accepting the proposed changes outlined in italic text on Appendix 1. The committee is asked to note the business considered by the committee during the 2019 to 2023 as outlined in Appendix 2, and the committee is asked to note and agree the recommendations as set out in Appendix 2 of the Committee Way of Working Report, 2nd of March 2023.
And is that seconded?
I second.
And agreed? Perfect then.
Sorry, Chairperson, I do have one more thing to bring up, which is our venue for future meetings. I just wanted to put it out to the committee as to whether or not they wanted to remain here until the work that's proposed at Gunwharf for changes to the chamber take place, or do we want to return with immediate effect from the August meeting?
Councillor Goldman?
Well, whilst I admit it would, given the size of the committee we've got, it would be a tight squeeze to get us all in room 9 at Gunwharf. I must confess I found tonight particularly difficult with the acoustics in this room. This is a wonderful building, it's a wonderful room, but I don't think it's suitable for what we're trying to do. So, you know, I've had hearing difficulty for many years. I spent 40 years working in ships' engine rooms, and that's taken its toll. And I must admit, I did struggle to hear colleagues' contributions this evening. And so, whilst it's a squeeze, I would be happier at Gunwharf, to be honest with you.
Yeah, sorry. Is that everybody? Nobody else wants to speak?
So we're agreeing that we'll be moving back to Gunwharf from the August meeting. I know, it is quite stuffy in there. Okay, thank you.
Then I do declare the meeting closed now. We're done.
Thank you.